Welcome to the ER. How can I help you?
I have these red lumps on my arms. They really hurt.
When did those start appearing?
A few days ago, I think. What are they?
That is an abscess caused by infection, and you have a few of them.
An infection? Am I gonna be okay?
Depends. What have you been injecting into your arms?
How did you...
Have you been using drugs to get high?
No! I'm not getting high.
Okay, then what are you injecting into your arms? Because it's clearly something, and you should probably stop. You're only 16.
Can I just see a doctor, please?
Yes, just a few more questions and I'll bring you back, okay? Austin, I put a patient in room 2. 16-year-old girl with multiple abscesses on her arms.
Multiple abscesses? From what?
Drug abuse. Duh, that's what I'm thinking, but she's denying drug abuse. Of course, they always do.
Were you able to get a urine sample?
Already sent to the lab. Her one other complaint, she's more tired than usual. Oh, 1000% drug abuse.
I guess we'll know soon. I'll go say hi. Hi, Charlotte. My name's Austin. I'm gonna be your nurse today. What's gonna happen to me? Well, these lumps on your arms are filled with pus from an infection. The doctor will come cut them open and drain them for you. You're gonna cut me open? Yes, but we'll numb you first. It won't be painful. Oh no! Can you tell me how you got them? That's okay. I'm gonna go get some supplies. I'll be back. Hey, Doc. Lidocaine's ready for you in room 2.
I'll be right there.
Did her labs come back?
Yep, she's clean. No drugs.
Really?
Yep, whatever she's injecting into her arms, it's not showing up in her urine.
Huh.
Can you also get me an IND kit and just be ready to wrap her up and get her out of here?
Sure thing. The doctor will be in soon.
Okay.
Look, we know it's not drugs, but it's really important we know how this happened to you so we can help you prevent it from happening again. You don't want to come back to the ER for this. Trust me. I just hate how I look. What do you mean? Everyone makes fun of me for being so pale, and I'm tired of going to tanning salons. So you're getting high because people are making fun of your skin? No, I already told you I'm not getting high. Then what are you doing? I went to the vitamin store and bought some over-the-counter melanin. I injected it into both my arms. Charlotte, there's no such thing as over-the-counter melanin. You're either born with it or you're not. Yes, there is. I still have the bottle. Look. Charlotte, this is melatonin. It's generic melanin. No, they're different. This is a medication to help your circadian rhythm and sleep, not skin pigmentation. That's probably why you've been so sleepy. Oh, that makes a lot of sense.
Okay, who's ready to drain some pus? What just happened in here?
Oh my god. Help! My husband needs help!
What's going on, ma'am?
His penis is very swollen.
I had an allergic reaction.
Ugh! It feels like it's gonna fall off.
I'm gonna have you take your pants off. How did this happen?
It's all my fault. I read online that you could use coconut oil for vaginal dryness, but he has a nut allergy.
Gotcha. Okay. No worries. We'll get you back there and get that taken care of right now. Your husband is doing much better, ma'am. He's almost ready to go home.
Oh, thank you.
I would avoid any more coconut oil in the bedroom.
Yes, of course.
I would suggest trying other vaginal moisturizers like KY jelly.
Jelly?
Yes, KY jelly.
If I don't have KY jelly, can I use grape jelly?
No, nothing from the kitchen.
Oh, okay.
Welcome to the ER. How can I help you?
This is my daughter and she has a fever of 325 degrees.
Ma'am, that's not possible.
Yes, it is. I checked.
How did you check?
I touched my oven and then I touched my daughter. They were the same temperature.
Was the oven on?
Yes.
Was it set to 325 degrees?
I believe so.
Your daughter's gonna be fine.
Where are you going?
To get your discharge papers! Ma'am, we have already gone over this. You have to remove all of your piercings before going to MRI.
I don't understand why.
Because the MRI is a magnet. It will rip the piercing off your body.
Then you do it, because I'm not doing it.
No one here is going to help remove your clit piercing for you. So either you do it yourself or the MRI will do it for you.
Ugh, fine.
Thank you. Welcome to the ER. How can I help you?
I swallowed an ice cube yesterday.
Okay. Did it scratch your throat?
No, but I'm scared. It hasn't come out yet.
What do you mean it hasn't come out yet?
I haven't pooped it out yet.
You're not supposed to.
But it's been over 24 hours. Shouldn't I have pooped it out by now?
No. Welcome to the ER. How can I help you?
My son has a fever of 325 degrees.
How did you check his temperature?
I touched my oven and then I touched my son. They felt the same temperature.
I see. Let's just check it again here to be safe. Was your oven set to 325 degrees?
Yes.
I would suggest getting an actual thermometer to check his temperature next time. They are way more accurate. Look at that. No fever.
Oh, thank goodness.
Yeah, it's a miracle. Hi. Aren't you lucky to be alive? Ambulance is here. What you got? 27-year-old male found unconscious in his home. His female partner called it in. Said they were shrimping right before he passed out. What is shrimping? That is when a man ejaculates into a woman's rectum, then inserts a straw to suck out the semen and blow it back into her mouth. Really? According to the female partner, yes. Why did he pass out? Well, because when he inserted the straw, she farted. Huh. Is he awake now? Yep, vitals are stable, female partner's on the way. Good luck. 518, all clear. Move out! Alright, what do we got? 35-year-old female, chief complaint of abdominal pain, says she thinks she's pooping, but she can't get it out. Took 4 of us to get her here. Why? She's 650 pounds.
Oh, get it out of me! It hurts! Ah!
Who called it in? Her boyfriend. He's on his way.
Help! Please, I can't shit!
Are your guys still here? Can they come help lift her legs so I can see what's going on? Fellas, get in here. We gotta spread a woman's legs.
Laura, I'm here, baby!
That would be the boyfriend. Great, he can come help too. Everyone, grab a leg. I see something. What is that? Is that a baby? She's having a baby? We're having a baby?
I'm having a baby?
How did you manage to do that?
Love. Help! All this time we thought it was shit, but it's a baby.
If only every shit could be a baby.
Oh, kiss me, Bert.
I love you, Laura.
Will somebody please call labor and delivery?
Ma'am, you do not need a prescription for ibuprofen. You could buy it over the counter.
I have bought it over the counter and it's not the same. Yours is stronger.
It is exactly the same.
You said you gave me 600 milligrams for my pain.
Yes.
I only have 200 milligram tablets at home.
Then you take 3 of them.
But you only gave me 1.
Because the ER has 600 milligram tablets of ibuprofen. If you only have 200 milligram tablets, then you take 3 of them. It is the same thing.
Can't you just give me the ones you have?
No! Hi, sir. What brought you into the ER today? Animal bite? What animal? A squirrel? Where did it bite you? My penis? How did that happen? Well, I was outside, and I saw a squirrel tail in the snow, and when I pulled it out, it bit me. Is there anything else going on or that you want to tell me? No. That's it. Have a seat in the waiting room. We'll call you in soon. Okay. Should I pull my pants back up? Yes! Dorothy, are you sure you don't have anything metal below your waist?
No, I don't think so.
Well, we got your x-rays back, and there's definitely something metal in your pelvic area. Are you sure you didn't have any surgeries or maybe put something up there?
No! You know what it is.
Is that a dollar bill safety pin to your underwear?
It's in case I need to call a cab.
I see. Well, hold on to that, and we're gonna do the x-rays again, okay?
Can you hold it for me? I don't want to lose it.
Of course. Let me get some gloves.
Call
Code blue! Patient's heart's not beating! Someone page the doctor and get me a crash cart! We need more blood! Ugh. Emergency room, how can I help you?
Hi, I gave my son a vitamin today, but I cut the vitamin in half before I gave it to him. How do I know which of the vitamins he got?
Ma'am, he gets half of all the vitamins.
Really? Oh, that's fantastic. Thank you.
You're welcome.
Excuse me! I'm having chest pain!
Right this way, ma'am. We're gonna do an EKG.
Please hurry!
What is this bandage on your chest?
I had a biopsy to check for breast cancer a few days ago.
The scar looks fine to me. Let me grab the doctor. I'll be right back. Hey, Doc.
What's up, Ben?
I got a lady with chest pain in room 2. She had a breast biopsy a few days ago. The scar looks fine. Her heart rate's a little high, but the EKG looks normal. Alright, I'll be right there. Hi, ma'am. My name's Dr. Wang. I understand you're having some chest pain. Ben filled me in. Everything looks pretty normal right now. I'm gonna check your scar. We're gonna get some blood work and a urine sample from you, okay?
Okay.
Have you been using any drugs?
Drugs? What do you mean drugs?
Meth, cocaine, nicotine, Adderall, vapes?
No! I have been sober for 7 years! I would never!
I just have to ask, ma'am. I didn't mean to offend you.
Why don't you learn to do your job instead of assuming all patients are on drugs, asshole?
Ma'am, it's just a standard question in the ER. There's no need for name calling.
Fucking asshole!
I'll be back. What the hell was that?
I don't know. She just blew up on me.
She wasn't like that in triage.
Huh.
What do you want to do?
Get a tox screen on that urine sample.
You think she's lying? Only one way to find out. Ma'am, your lab results came back. They found meth in your urine.
What?
Do you have any idea how it got there?
I relapsed last night. Fuck!
I see.
After 7 years! I feel so stupid! This breast cancer has gotten me so stressed out!
Look, staying sober isn't easy. But we're gonna get you help, okay? For everything.
I'm sorry.
You don't have to be sorry. People relapse. Many people do. I promise you're not alone.
Okay.
I'm gonna bring the doctor back in and we're gonna figure this out. You're gonna be okay.
Excuse me!
Yes, ma'am. How can I help you?
I need to be looked at right away. Something is seriously wrong.
Just tell me what's going on.
This morning while I was going to the bathroom, a freaking fly flew out my butthole, okay?
You think a fly flew out from your butthole?
Yes!
A live fly?
Yes!
Ma'am, I don't think it's possible for a fly to survive in your body and then fly out.
Are you implying that I'm making this up?
I'm just saying that it's probably more likely the fly was already in the toilet when you sat down to go to the bathroom.
Unbelievable!
What?
That's exactly what my doctor said when I called him this morning.
Well, it's probably because that's what happened.
A woman knows her body, and I am 100% certain that that fly flew out my butthole, okay?
Ma'am, please.
And I would appreciate it if you could run some tests or do some blood work to see why the hell it's happening.
There is no test to check for flies in your butthole.
You could take a stool sample, can't you?
We are not taking a stool sample.
Well then, what are you going to do?
Nothing.
That's it, I'm leaving. I'm going to another ER and I'm gonna have them examine me.
Please let us know what you find.
Do not make fun of me! If they check my butthole and they find flies up there, I'm gonna sue you and this entire hospital! Whoa, what was that about?
Oh, nothing. She was threatening to sue the hospital if another ER found flies in her butthole.
Oh. Okay. Do you want to go to break? Welcome to the ER, sir. How can I help you?
I slipped and fell on a water bottle.
Oh.
It's stuck in my butt and I can't get it out.
Is it a plastic water bottle?
Yeah.
Okay, we'll get an x-ray to see where it is, and then we'll help you get it out. Hello?
Hey, Austin. You should look at the x-ray for bed, too. Water bottle butt guy wasn't exactly telling the truth.
What the... Sir, we got your x-rays back.
Do you see the water bottle?
We see 2 water bottles.
What? Oh! That's right! I have 2!
How did you forget that?
I put the first one up a few days ago. I guess I forgot. Can you get them both out?
Yes, the surgeon's coming down to talk to you right now.
Okay. Thanks! Ma'am, you are having abdominal pain because you are pregnant. There is no way! I can't be pregnant! We tested your urine sample. You're pregnant. I'm telling you, that's not possible! Are you sexually active?
What? No, not exactly.
It's either a yes or a no. Are you sexually active?
No, I wouldn't say active. I kinda just lay there.
So that's a yes.
Can't you just run the test again?
No! Welcome to the ER. How can I help you?
I'm having a stomach ache.
When did it start?
Like an hour ago, after I swallowed a fork.
You swallowed a fork?
Yeah,
Why did you swallow a fork?
I wanted to see if I could do it.
What? Have you tried it before?
No.
You're sure you swallowed a fork?
Mm-hmm.
Okay, well, we're gonna need an x-ray just to be safe. Are you able to walk? Can you follow me?
Yeah.
There is no way he swallowed an entire fork.
You never know. I once had a pica patient who swallowed rocks and chunks of concrete. They can't help it.
Have you called psych yet, Ben? Not yet. I want to confirm the fork on the x-ray first. Oh, here it is.
Oh my god. What is all of that?
Sir, we got your x-rays back.
Do you see the fork?
Yes, we see the fork. We also see half a dozen coins, a toy car, and another object I can't even make out.
Oh, it's part of a TV remote.
I knew it! Sorry. Sir, this is very dangerous. You're gonna need surgery to remove these objects.
Oh, but those aren't bothering me. It's just the fork.
Sir, your pain is being caused by all the objects in your stomach.
No, those have been there for years. It only happened after the fork.
What do you mean, years?
I'm telling you, it's only the fork that's bothering me.
Alright, look. We can figure this out, okay? I'm gonna go get you some pain meds, and I'm gonna have some people come down to talk to you. Just don't move in the meantime. Okay?
Fine, but nothing except the fork is coming out.
That will be between you and the surgeon.
And I've got something for you right here. She's got a gun! It's a letter, Lisa.
I was a first responder being called to a mass overdose call near the beginning of the opioid crisis. I thought we would be responding to a triage nightmare, but it turns out it was a bachelor party of a dozen guys who split a large cannabis gummy and none of them can cope with their high. How big was this gummy bear? Was this everyone's first time getting high? Each patient had different symptoms from anxiety, confusion, nausea, passing out, etc. Again, how strong was this gummy? And where can I get one? Due to the number of patients involved, we had 2 fire trucks, 3 ambulances, and 2 police cars. When what you really needed was a taco truck. They didn't need Narcan, they needed nachos. Needless to say, after a quick assessment of each person, everyone declined transport. Ah yes, nothing will sober you up faster than hearing the lights and sirens of a police car. Glad these guys are okay. Was working in triage when a man presented a brown bag on the triage desk and told me, "You can keep these. I won't be needing them anymore." When I opened the bag, it was his testicles. Excuse me. He had come to the ER because after removing his own testicles, he had sewn himself up with dental floss and thought he might have an infection. Oh my god. He had recently been denied gender reassignment surgery. And that, my friends, is what the ER calls a Tuesday. I feel kind of bad for this person. They wanted gender reassignment surgery so bad they did it themselves. I mean, the balls on this guy. I guess not anymore. Real patient stories submitted by healthcare workers at my comedy shows in Edmonton, Canada. Got called for a chief complaint of ghosts in my butt. Okay. Arrived on scene and found a male who was naked, bleeding, and obviously self-medicating his out-of-control schizophrenia with pint. Shittiest meth you can buy, of course. Just another reason not to do meth, kids. It shrinks your dick, rots your teeth, and ghosts in your butt. Needless to say, my partner gave him a shush push of Versed, and docs had to fix his completely prolapsed rectum. Oh, it damn near killed him. That's not good. But shush push, also known as the Cosby. I feel like if I were a ghost, the last place I'd like to spend eternity is in a guy's hole. But I don't think they get to choose, so...
Joke's on you, I'm into that shit!
Welcome to the ER. How can I help you?
My husband's eye is really red and swollen, and it won't go away. It's been like this for months.
Let's take a look. Oh wow, it's really inflamed. Have you seen a doctor for this yet?
His doctor gave him some eye drops, but it did nothing.
Okay, we'll run some tests. I'll be right back. No way. Ben, what's up? I'm about to tell this couple that the husband has chlamydia in his eyes.
What? How do you think he got it?
Either his wife has it or he's been sleeping with someone who does.
I'll bet you it's the neighbor.
Oh, it's always the neighbor. Will you distract the wife while I tell him?
Yeah, let's go.
Okay, sir, I have your test results.
Oh, do you mind waiting? My wife just stepped out.
You have chlamydia in your eyes.
What? You can get chlamydia in your eye?
Yes.
How is that even possible?
You must have touched someone with chlamydia and then used that same hand to touch your eye.
Does that mean my wife has chlamydia?
It does, unless you've been sleeping with somebody else.
Oh no!
Either way, we should get you guys tested.
I'm back. Honey, why are you crying?
Jasmine, I need to tell you something.
What's going on? Honey, you're scaring me.
Maybe I should go.
I've been sleeping with someone else. What? You're cheating on me? With who?
It's our neighbor.
I knew it!
Rich!
Sorry. You've been sleeping with Carol?
Not Carol. Fred.
Fred?
Fred?
Who is Fred? Her husband?
Her husband?
I'm sorry. You're cheating on me and you're gay? Oh, I can't believe it. Me neither.
Rich!
Sorry. Everything makes so much sense now.
Right. I'm gonna give you guys a minute. Just take your time. No rush. Wow. Oh, I almost forgot. You could pick up your prescription for the chlamydia medication at the front desk on your way out.
The what medication?
Sorry. Now I'll go.
Hi, ma'am. My name is Ben. What brought you into the ER today? I'm having a really bad stomach ache. I'm so sorry to hear that. We will need a urine sample from you to rule out a UTI, okay? Oh, but I'm on my period. Oh, that's okay. There's some wipes in the bathroom. Make sure to really clean your area. Wipe away as much of the dry blood as possible, and always wipe from front to back. When you start peeing, catch the urine midstream. You don't want any from the beginning, okay? Oh, okay. Thanks. I didn't know that. No problem. Oh, and don't fill the cup all the way to the top. Half cup is more than enough. Okay. I'm all done. Here you go.
Great. Oh, it's full.
I know, I panicked. I'm so sorry.
No, that's okay.
My aim isn't very good either.
I'm gonna get a towel.
I'm so sorry.
Trust me, girl. You're not the first person, okay? I'll be right back.
Thanks, Ben. Hi, ma'am. My name's Rich. What brought you into the ER today? I'm off my food.
Okay.
I'm acting strangely. I feel snippy and aggressive, and I can't show affection to my beloved. Are you even listening to me? Sorry, ma'am. Is there something in your bag? No. Something is definitely moving in your bag. It must be your imagination. It just moved again. Are you just gonna stand there and argue with me about my bag? Or are you gonna get me help? Someone needs to give me medicine. What's going on here? I'll tell you what's going on. It's almost midnight, the vet is closed, so you brought your dog, hidden in your bag, to the ER and you're trying to pass off its symptoms as your own. How dare you speak to me like that? I've never been more insulted in my life. You brute! You brute! You absolute brute! Oh, my chest! Oh my god, ma'am, are you okay? I feel so dizzy and lightheaded. Take a seat, ma'am. Can I get you a glass of water? A bowl will be fine, thank you. Unbelievable.
So we got your x-rays back, and you weren't kidding. You have 2 full-sized Fuji apples deep inside your rectum. Yup. Can you just explain to me how this ended up happening again? Well, I wanted to put something up there, naturally. And I had just gone to the farmer's market, and an apple seemed like a good challenge. So I lubed it up and jammed it in there. I see. But right when it went in, I knew it wasn't coming out. So I came here to get help right away.
Okay, but
Why the second apple? Well, if I was coming into the ER anyway, may as well see how many I can get up there, you know? Ah. Of course. The answer's 2. The third gave no give whatsoever. That's good to know. Hey, I'm gonna need you to prep the operating room immediately. Yeah. A homeless patient residing in our medical unit for the last 7 months had the audacity to question my education and experience when providing wound care to his toes after he'd ripped off his toenails while under the influence of heroin. Oh no. Kids, don't do drugs! Oh, that is painful. We gotta start using heroin in the hospital. He probably didn't feel a thing. He spent 7 months in the hospital. He's probably got more experience than most of the nurses there. Everybody's quitting. You'll be lucky to have a nurse that stays past 6 months. Okay? Healthcare sucks! On the other hand, if you're homeless and you want 7 months of shelter and warm meals, rip off all your toenails. Can I get some help? Yes, sir. How can I help you? I got pretty dinged up at work today, and the wife forced me to come in and get checked out. Sir, you're bleeding. I think I'm fine, but you gotta do what the wife says, you know? Okay, tell me what happened. Just a small cut, sort of like a puncture wound in my abdomen area. Just need to get it cleaned and stitched up. How did it happen? Well, I'm a rancher, so these things tend to happen from time to time. Just part of the job. Okay, but did you fall on something, or? More like something fell into me. Can you be a little bit more specific? Sure. Do you know what bulls are? Like, the animal? Yeah. I got attacked by one. You got attacked by a bull? Well, not a bull, my bull. What caused the puncture in your abdomen? His, horn when he rammed into me. Oh my god! What? Sir, this is serious! You think so? I mean, it's just one hole. Rich! Trauma 99, now! Or I guess 2 holes if you count the one in the back. The one in the back? Well, yeah, the horn came in and out of me. You have an exit wound? Yeah, I'm like a piece of Swiss cheese. I'm also feeling a little sleepy. Someone get me a wheelchair! Hey, this seems awfully serious. Do you think I'll be home in time for dinner? No! Oh boy, someone's gonna have to call and tell my wife. She's gonna be mad. Welcome to the ER. How can I help you today, sir? I think I'm ODing. What did you take? Ah, okay. I had never done it before, and I don't feel good. That's okay, let's just try to stay calm. Do you know how much marijuana you took? I don't know, but I've never done it before, and now I'm freaking out. I think it's gonna kill me. It's not gonna kill you. You can't overdose on marijuana like that. What you're experiencing is just a little anxiety from taking too much. My heart feels like it's about to explode. It's not going to explode. My pastor was right. This drug is from the devil's garden. I'm sorry, God. Please don't take me. Sir, you're gonna be okay. Please just sit down. I read online that Narcan can reverse an overdose. Do you have any Narcan? No, you don't need any Narcan. Just give me the Narcan, man, before it's too late. Patient arrived in the ER with chief complaint of anxiety from consuming marijuana. Patient claims, quote, I'm going to be the first person who dies from this drug, end quote. Patient then demanded an injection of Narcan. Patient was instead given an apple juice, a turkey sandwich, and a National Geographic magazine, which seemed to cure patient of all negative symptoms. When asked how patient was doing an hour later, patient said, quote, great, I'm coming back next week, end quote. MD notified, awaiting discharge, will continue to monitor. Since COVID, lazy patients want telephone appointments. One day I got a call. This female wanted a full physical with a PAP. I said no problem and gave her a date and time. She then says, well, can I just have the appointment on the phone? On the phone? Sure, put your vagina on the phone. We'll ask it what's wrong. I had to hold my breath so I wouldn't say something back and get fired. I would have been fired. After about 30 seconds, I said, no, hun. We can't do a PAP over the phone. Well, we can try, but you're gonna need a mirror, a very large set of pliers, and perhaps a long Q-tip. Also, ladies, if I can hear what's wrong with your vagina over the phone, you're gonna need a lot more than a doctor. May I suggest an exorcist?
Emotional, damn it!
Welcome to the ER, sir. How can I help you? I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Okay. Were you using protection? No. Was there an accident? Yes. How long ago did this happen? Last night at 7 p.m. on the couch. I just need an approximate time. Doggy style. We have this medication called Plan B. Since this incident happened within 72 hours. Oh yes, I got that for her already. Yesterday, right after we finished. Okay, great. We want to know if there's anything we could do right now to know if she's pregnant. Unfortunately not. She'll have to wait about 3 weeks to see if she gets her period. If she doesn't, then she could do a pregnancy test. There's no other option? You could do a blood test for faster results, but even then, you're gonna have to wait a couple weeks. Oh jeez. We're just really anxious because she really doesn't want to be pregnant. I understand. Is there anything she could take to prevent the pregnancy? Any multivitamins, minerals, food? She's already taken it, which is the Plan B. There are other options, but those are all prescriptions. There's really no other over-the-counter products she could take. Okay, what about me? What about you? Is there anything I can take to prevent the pregnancy? Any multivitamins, minerals? No, sir. There is nothing you can take right now to prevent the pregnancy. Are you sure? Have you checked? Yes, I've checked.
I will look for you. I will find you. And I will kill you.
Good morning, Rich.
Austin, hey, I got a patient for you in room 2, Mr. Lindsay. He's here for constipation, but has a psych history.
Okay, I'll go say hi.
I'm gonna try to call you a sitter in the meantime.
Thanks.
Good luck!
Hi, sir. My name is... Oh my god! What are you doing?
Pooping?
Don't do it there! Go to the bathroom!
Oh, okay. Where's the bathroom?
I'll show you! Just stop! Hold it! Rich, can you call housekeeping to room 2?
What happened?
Mr. Lindsay pooped on the floor.
Shut the fuck up.
Oh, yes! Are you sure he's here for constipation?
Oh my god!
This isn't funny!
Oh, relax. It's not like it's the first time it's happened.
It's the first time it's happened to me! I almost got it on my shoes!
No way! Oh, I'm so glad I gave you this patient.
I'm not.
It should happen to everyone at least once, like a rite of passage. Smile because it happened.
You suck.
It's like going through nursing puberty. Oh, nursing poopery! Austin?
Okay, Mr. Lindsay, do you have any allergies to medications?
Yes, Narcan.
What happens when you take Narcan that makes you allergic to it?
It takes away my high, and I don't like it.
Mr. Lindsay, that doesn't count as an allergy.
It does to me!
That happens to everyone when they get Narcan.
I don't like it.
Okay, you're here because you're constipated, right?
Sort of.
What do you mean, sort of?
I put some fentanyl in my butt, and I can't get it out.
Is that why you were trying to poop in the room?
Yeah, I think I almost got it though.
No, do not try again. Wait, I'm gonna get someone to help us to the bathroom. Just wait, okay? Rich, were you able to get that sitter?
No, they're short-staffed again.
This day cannot get any worse. Can you help me get Mr. Lindsay to the bathroom?
I'll be right there.
Someone's coming to help us, Mr. Mr. Lindsay? Mr. Lindsay! No! Rich! Help!
What happened?
He's ODing on fentanyl! I need some Narcan!
Where did he get fentanyl?
He had it in his butt! Get me a crash cart!
Right!
34-year-old male chief complaint of constipation and allergies to Narcan. When asked what happens when the patient takes Narcan, patient states, quote, "It takes away my high and I don't like it," end quote. Education provided. Patient was later found overdosed on fentanyl he had hidden in his rectum. RN administered Narcan 6 times, which saved the patient's life, but ironically caused an allergic reaction, resulting in a severe rash across the patient's body. Patient is now stable but combative and agitated at staff for ruining his high. Awaiting security. Will continue to monitor. Hi, sir. What brought you into the ER today?
The bugs are back.
The bugs?
They're all over my legs, and they're sores too.
How long has this been going on for?
A few weeks. I came in about 2 weeks ago for the same reason too.
Oh.
But I put canned gravy on my legs because the bugs like it.
You did what? Why?
My brother brings me canned goods. I thought by putting gravy on my legs, it would help my leg wounds, but I realized the bugs like it too.
Okay. Let's take a look.
Here you go.
Oh, God! Oh!
What is it?
Sir, you need to stop putting gravy on your legs. These are maggots. They're literally eating your legs.
I know.
What do you mean you know?
Like I said, I was here about 2 weeks ago for the same reason.
They didn't tell you to stop putting gravy on your legs?
They may have mentioned it. I just thought it'd be a good idea.
No! No more gravy on your legs!
Alright, I'll stop. How was I supposed to know?
Yes, Mr. Mickelin, how can I help you?
I gotta go. I'm dead.
Mr. Mickelin, we've already gone over this. You're not dead and you can't leave yet.
I am dead. There's no use for me here.
It's almost time for your medication and I have to get your blood sugar.
How are you gonna get my blood sugar?
I'm gonna prick your finger for a drop of blood and then put it into my machine.
You can't get my blood. I'm dead. Dead people don't bleed.
If I can prove that you're not dead, will you please stop pushing the call light and go to sleep?
How are you gonna do that?
You said dead people don't bleed, right?
Of course not. Dead people can't bleed.
Give me your finger.
Ow!
Aha! What do you call that?
Well, I'll be damned. I was wrong.
I told you. Now please go to bed.
Dead people do bleed after all. Welcome to the ER. My name is Rich. How can I help you?
This is my son Jake. He's been coughing non-stop.
I'm so sorry to hear that. Jake, how long have you had this cough?
It started about a week ago. He woke up Tuesday and wouldn't stop coughing.
Ah, okay. Thank you. And Jake, are you having any pain when you cough?
Oh yes, the pain started 2 days ago. That's when I noticed something was wrong.
Thank you, ma'am. Jake, on a scale of 1 to 10, how bad would you say your pain is when you cough? Jake.
Oh, it ranges from 5 to 9 depending on when you ask him.
Ma'am, it's actually very important that we hear from the patient directly.
How much longer until we get a room? I wasn't expecting this many questions. We have places to be, you know.
Right. Okay, let's just get his weight and we'll get him back right.
He's 160 pounds, 5'10", and 16 years old.
Of course he is. Hey, Ben, can you take this patient and lovely mother back to room 2? Yeah, sure. Follow me, guys. So it says here that you're dealing with a pretty bad cough, Jake.
Yes, the cough started a week ago and the pain started 2 days ago. I already told this to the nurse outside.
Well, did the patient say any of this to the nurse outside?
I don't know what you're implying.
We still need to get your official weight, Jake. Can you step on the scale for me?
I already said he's 160 pounds.
149 pounds.
What? How can that be? He's always been 160.
Well, it looks like he's lost some weight. Can you take a deep breath for me, Jake? Does that hurt?
His pain can range from 5 to 9 depending on when—
Ma'am, please give the patient a chance to talk or else I won't be able to help him, which means you'll have to come back and I'll have to see you all over again.
Oh.
Have you been vaping or smoking, Jake?
Not my Jake. He would never touch that stuff.
Ma'am, can you do me a favor and find Nurse Austin out in the hallway for me? He's gonna finalize everything for you once you're through with me here.
Why? You haven't even done anything yet.
It's gonna help a lot. Trust me.
Okay, but if you have any questions, you let me know.
Okay, what really happened?
I'm 5'9", 149 pounds, 15 and a half, and a week ago I smoked an eighth of weed out of a bong I found in a dumpster.
Great. It's probably just a minor lung infection. You'll get a prescription for antibiotics that you could pick up on your way out.
Hey, I found that Austin guy. Did you guys finish?
Yep, he'll need some antibiotics, but he should feel better in about 3 to 5 days.
You guys can follow me. I'm glad Ben was able to help out so quickly, Jake. I'm not sure it was the nurse who helped him. I mean, I did most of the talking, and I still don't even know what's wrong with him. Jake won't tell me. You know, in situations like these, it's very important to let your child represent themselves as their own individual, especially when it comes to their own bodies and health. But I know everything about him. He's my son. I know, but he is a teenager. There may be some personal health issues or habits he's not comfortable sharing around his mom. It's nothing you're doing wrong. We just want to make sure we get the whole story so we know exactly how to help him. And sometimes that means letting your child speak for themselves. I never thought about it like that. I guess you're right. I'll try to be less overbearing. Thank you, Austin. And Jake thanks you too. It's gonna take a minute. No worries. Come on.
Excuse me, my girlfriend has an emergency and she needs to be looked at right away!
What's going on, sir? Okay, he's being dramatic. It's not really an emergency.
Oh, it's an emergency.
Okay, just tell me a little bit more about what happened. Oh my god, what's that smell?
That's why we're here.
I read online that yogurt is supposed to be good for maintaining proper normal flora in your gut and your vagina. Oh yes, I've heard the same thing. It's great for maintaining good bacteria within your body and can even help keep a healthy pH balance. See, I told you yogurt's good for you.
Yeah, when you eat it!
I'm sorry, what's going on?
She wasn't eating it.
If you weren't eating it, then what were you doing with it? I thought it was supposed to go in my vagina. You know, where the flora is. Oh. How long have you been putting yogurt in your vagina?
Several days.
Oh my god, is that what I've been smelling?
Yeah.
Oh dear. And when did you realize this was a problem?
Earlier today, when my boyfriend and I were having sex.
Oh, what happened during...
I didn't even notice there was a problem. We were only about 30 seconds in when my boyfriend put my pants on and said we have to go to the doctor right away. You think it smells bad? Just imagine the taste.
Oh my god! We have a trauma coming. Motorcycle accident. ETA 6 minutes.
Finally, a real emergency. I'll take it. Whoa, how come you get to take it? Because I called it. That's not how that works.
We're a little short-staffed today, Rich. Will you make sure the waiting room patients are okay?
The waiting room? Next motorcycle accident is mine. Stupid waiting room. Ryan Clark, are you here? Nurse, my daughter needs help. Whoa, just try to relax and tell me what's going on.
My water broke.
She's going into labor. Oh no. Okay, just wait. Let me call upstairs.
I think the baby's coming. Mom, is Gary here?
He's coming in now.
I see him. It's her husband. Fantastic.
Austin!
What is it?
She's going into labor. Where's the doctor?
He's still in the trauma. Are you calling labor and delivery?
Of course I'm calling labor and delivery. No one's picking up.
Okay, wait here. I'll be back.
No, don't leave me. I'm here, honey.
Gary,
where is the doctor? My daughter is about to give birth. No one is giving birth and he's going to be here any second now. What if the doctor doesn't get here in time? Are you trained to deliver babies? Yes. In case of extreme emergencies, I am highly trained to deliver a baby. But she's fine. Just keep breathing, ma'am.
Have you ever been part of an orgasmic birth?
A what?
She's always wanted an orgasmic birth. It's supposed to help prevent any subconscious resentment towards your child.
Oh, well, whatever you guys want to do, I guess.
Okay, honey. The nurse said he's fine with it. You could start now.
Oh, honey. You want me to start right now?
Yes! Hurry!
What is happening? Honey, I don't think I can.
What? But this is what we planned on!
Will somebody please pick her up? Yeah, but your mom's here. And to be honest, it looks pretty crazy down there. I don't think I even know where your clit is anymore.
You barely knew before, and that never stopped you!
Oh my god, the baby's crowning. I see a head. Somebody get me some towels!
Gary, hurry!
What if I accidentally poke the baby's eye as it comes out or something?
But this is to help our relationship with our child!
Well, do you think everyone can leave the room first?
They can't leave, Gary!
Well, then I can't do it. I'm sorry.
Nurse?
What?
Are you able to help me?
Oh, no. I mean, the hospital would never let me, and even if they did, I wouldn't. Oh my god. Okay, baby's coming. Go slow, deep breaths.
Honey, please!
I can't!
Hurry!
I told you I can't!
Here it comes! If my baby girl wants an orgasmic birth, she's gonna get an orgasmic birth!
I can't look. Watch his head. Hey guys, hope I didn't miss anything.
24-year-old female went into labor during triage in ER waiting room. Upon further assessment, patient's baby was found crowning and patient requested assistance in achieving an orgasmic birth from both husband and myself. After both refused, the patient's mother stepped in and manually helped her daughter achieve her goal in just under 30 seconds, right as the baby arrived. Patient's husband then commented on how quickly the climax occurred, to which the patient's mother replied, quote, "Mommy knows best," end quote. Social worker consult requested. Therapy recommended for husband, and law enforcement intervention has also been recommended to observe the entire family. Patient and baby successfully transported to labor and delivery.
Did all of that really happen? Why didn't you just call labor and delivery first? Ah, okay, stop! No, stop! Rich, stop! Rich, stop! Austin, help! Austin! Austin, help! Good morning, my name is Rich. What brings you to the ER on this lovely Sunday morning? I'm feeling really depressed. Oh, okay, do you have any thoughts of hurting yourself? Yes. Okay, we're gonna get you back right now and try to get you some help as soon as we can, okay? Wait, I'm scared. What's gonna happen? Well, first we're gonna change you into a hospital gown, and we'll keep all your belongings labeled in a locker for you. Can I at least keep my phone and bracelets?
No, unfortunately, we have to keep everything. If it's not too busy, you can ask your nurse to use your phone every now and then, but you can't keep it with you. Okay. We're also gonna have someone sit with you at all times while you wait to speak to a psychiatrist. Is that to make sure I don't run away or hurt myself? Yes. They'll keep an eye on you at all times, including when you go to the bathroom. Unfortunately, a lot of incidents happen when patients lock themselves in the bathroom. How long till I see a doctor? Look, I won't lie to you, it could be a very long time. Our psychiatric doctors don't live in the ER, but we'll page them as soon as we get you back. What about the ER doctor? Will I see the ER doctor? They might come say hi, but they won't be able to do much besides get you some meds to ease any anxiety. We have to wait for the psych team. How long will I have to be here for? Our social worker will try to get you transferred to a psych facility ASAP. But it could be all day. All day? What if I want to leave? We can't let you leave. That's so unfair. I don't want to spend all day in the ER. I want to be able to leave when I want to. Think about it, okay? If we let you leave after you come to us for help and something happened to you, we would never be able to forgive ourselves. I just want to get better. I know, and the ER's job right now is to make sure that you are safe until you can get the help you need to get better. It's not a perfect system, but we're gonna do our best. Okay. Thanks, Rich. No problem. Okay, follow me.
Stephanie Shu, will you follow me, please?
Excuse me, I've been here for a very long time. Am I gonna be seen?
What's your name?
Harrison Brown.
I don't see your name on our computer. Have you been checked in?
No, I've been waiting for someone to come talk to me.
You just walked into the ER and sat down?
Yeah.
How long have you been sitting here?
At least half an hour now.
You didn't think to tell anybody?
I'm telling you.
Ugh. Okay, really quickly, what brought you into the ER today?
I haven't been able to poop.
How long has that been going on for?
I think my girlfriend put a hex on me.
What?
My girlfriend. She caught me cheating and I think she put a hex on me. That's why I can't poop.
Sir, just give me a second. Wait here. I'll have someone come out, check you in. Stephanie, will you please follow me?
Do you know how much longer this is gonna take? I have to get back to work. Ugh.
Tips from the ER. Granny dumping. Were you planning on dropping off your demented granny at the ER and disappearing into the night? You naughty child. How dare you? I know your dear old granny is struggling these days to remember your name, and their favorite pastime is now spitting in your face at ungodly hours. But this is an emergency room, and there is nothing medically wrong with them that the ER can help them with, and you know this. Stop abandoning your senile family members at the ER and ghosting us. That fake contact info you left us? Cute, but as useful as a screen door on a submarine. We do not have time to babysit wrinkles and save a dying child. So, the next time you're thinking about turning your local ER into a convenient nursing home drop-off center, remember, your parents used to wipe your dirty little asses when you were just a useless baby. It's time you return the favor. Okay? Come pick up your grandmas, motherfuckers. Tips from the ER. 3 ways to be the perfect patient in the emergency room. Do not pee without telling us.
We need that urine.
A quick test of your urine is one of the best and easiest ways to find out what's going on with you. If you pee without telling us, we will wait for you to pee again. And that could be the difference of hours in the ER. Do not try to get up on your own if you are unstable, especially if you've just been given pain medication. Pain medication in the ER can be very strong and will make you dizzy. If you try to stand up without assistance, fall and hit your head, you could potentially be stuck in the ER for something much worse than what you initially came in for. Do not leave your bed or the ER without telling someone first. If you need to use the bathroom, make a phone call, or you've decided you've had enough and you want to go home, tell us. There is already a million things going on in the ER, and looking for your hairy butt is not something we'd like to add to the list. And if you leave the ER before we take out your IV, we will call the police to hunt you down. Excuse me, but I need to get my daughter into a room right away. I can help you, ma'am. What's going on?
She's pregnant and she's only 15 years old.
Is she having any issues, like pain or bleeding?
No, but it's very important that we be seen right away.
Well, unfortunately, if it's not an emergency,
I'll give you $1,000 to get us a room right now.
Ma'am, this is a hospital, not a nightclub, so we don't really do that sort of thing here. $3,000. I'm sorry, ma'am. The answer is still no, no matter what number you say. $4,000? Ma'am, if there's nothing wrong with your daughter, why are you trying to get her into a room so badly? The wait's not even that long.
Because she's pregnant.
I'm aware, but...
With God's baby.
I'm sorry, what?
This is the second coming of the Lord, don't you see? It's crucial that we get her looked at.
I know I'm gonna regret asking this, but why do you think she's pregnant with God's baby?
Well, because she's a virgin, of course.
Gotcha. I'll see what I can do. Hey Doc, how's your day been? Pretty good so far. I'm gonna ruin it. We have a woman out here who wants a room right away for her pregnant teen daughter. Okay, bring in room 1. I'll check on her in a minute. Well, there's more. The mother seems to be under the impression that her child is a virgin. Then how does she think her daughter got pregnant?
She thinks it's God's baby.
What? Oh. What do you want to do? Could you maybe help me get the mom out of the room so we could do an ultrasound? Yes, for sure. Hi ma'am, I'm Dr. Molina. I understand you have some concerns about your daughter's pregnancy?
Yes, but I want you to be very careful. This isn't just any baby my daughter's carrying. This is a child of God in her uterus.
Excuse me ma'am, can you help me clarify some things on this paperwork?
Well, I really should stay here with the doctor.
Oh no, the paperwork is actually very important. You should go do that ma'am. We'll have a female chaperone come in.
Oh. Okay.
Okay, we're gonna do a quick ultrasound while your mom's gone. Hi ma'am, so we did the ultrasound. Your daughter is perfectly fine and she's about 5 months pregnant with a very healthy human baby.
What are you implying?
Well, there is no evidence of this being a medical or religious miracle, so...
Are you trying to tell me that my daughter isn't a virgin?
Yes, that is exactly what I'm telling you. But like I said, everything looks perfectly fine.
There is no way in hell!
I would love to stay and chat, but any other questions can be directed to one of our best nurses here, Rich. Hi again.
Oh no. 15-year-old female brought in by her mother for a pregnancy exam. Upon arrival, the patient's mother demanded immediate attention for her pregnant teen daughter, who she believed to be a virgin carrying the child of God. When an ultrasound confirmed that the daughter was not a virgin and carrying a human child, the mother cursed at hospital staff and blamed the doctor for, quote, impregnating her daughter during the ultrasound, end quote. Security notified. Social worker at bedside will continue to monitor.
Welcome to the ER, sir. How can I help you?
Are you guys able to remove things that are stuck in someone's body?
Oh. Did you get something stuck? Down there?
What? No, nothing crazy like that.
My apologies, sir. Just tell me what happened.
I got a bullet stuck in my forehead.
Oh my god, what?
Oh yeah, but I'm fine. Just decided it's time to get it out.
Were you shot? How did this happen?
Well, a couple months ago, I was shooting my AR in my yard like I always do, and I was standing a little too close to the target. Long story short, the bullet ricocheted and nailed me right in the forehead.
This happened a couple months ago?
Sure did.
Why didn't you come to the hospital when it happened?
I figured I was okay, you know? It wasn't that bad, and I thought my body would just push it out on its own, like a splinter.
And have you been experiencing any pain, headaches, or lightheadedness?
Nope, I feel totally fine. I just want it out.
That's amazing. What made you finally decide to get it out now?
Oh, well, I'm getting married this week, and I want to look good for my photos, or the future missus is gonna kill me.
I see. Wow. Okay, well, have a seat. We'll be with you soon.
Thank you.
Hey, I need medical assistance!
What's the problem, sir?
It's my balls, man!
Did they get hit, or...?
They're really big and in a lot of pain.
Okay, don't worry. Everything's gonna be fine. Do you know how this happened?
Well, I purchased a testicle enlarger on the internet, and I'm not gonna tell you why, so don't even ask.
Okay.
Anyway, it worked a little too well, and they became bigger than I intended.
I see. And then what happened?
So I tried to pop them with a needle to deflate them back down to normal size.
Why would you use a needle? Your testicles aren't filled with air.
Well, I know that now. Anyways, they're really infected, and it's swollen and painful. Look!
Sir, you have to wait until... Oh my god!
I know, right?
They're huge!
I know, right? Hey, yo, can I get some help?
Hi, sir. My name's Austin. What's going on?
I got my mom in the car. I think something's wrong with her.
Oh, okay. What happened?
We got into a huge fight this morning. We were arguing, then all of a sudden she got real calm and quiet. At first I thought maybe she was giving me the silent treatment. You know, chicks.
Right. Chicks.
Anyway, she's been acting kind of weird for a while now, so I figured I'd take her to you guys.
Why is she still in the car?
She won't tell me. I think she's still mad at me. I even tried to take her to the McDonald's drive-thru to try to cheer her up, but when she wouldn't tell me what she wanted to order, I was like, shit, something's wrong. We better go to the ER real quick.
Can you show me where your mom is? Rich, can you help me bring in a patient from the car?
Yep, let's go. She right there. Maybe y'all can get her to talk. I'm gonna go have a smoke.
Sounds good, sir.
Hi, ma'am. My name is Rich. Oh my god.
What is it?
I think she's dead.
What?
Yeah, no, she definitely doesn't have a pulse.
Oh my god! What do we do?
Ma, you gonna talk or what? Sir, I don't know how to tell you this, but your mom is dead. What? Are you sure?
Pretty sure.
Well, can you fix it? No, pretty sure we can't fix dead, but why don't we get you inside and get you some help?
I can't believe that just happened.
I can't believe he didn't know she was dead.
I can't believe he took her body through the McDonald's drive-thru.
Hey, Ma, what do you want? Chicks. Hey, yo, let me get a double cheeseburger. Tips from the ER. Your congested nose. Oh! That's a whole lot of loogie. Look at his poor face. Guy looks like he just accidentally walked in on his parents getting it on. Irrigation devices are great for reducing congestion, even in kids. Only use distilled or sterile water. Non-sterile solutions like tap water contain microbes that can cause infection. Ooh. If you have a baby, you could use a blanket to wrap them up like a burrito so they don't flail around. Get ready, here it comes. This technique of wrapping up your baby is called swaddling. It's been so long since I've been held like this. We use this technique all the time in the ER if baby needs an IV or they need stitches around their head. One more time, just because it's fun. Ooh, so satisfying. I am way too hungover for this today. Can somebody dim these lights? Trenti mocha latte with 12 pumps of every syrup at the bar. Hint of caramel, low-fat whipped cream. Trying to watch my figure. Caffeine's in my veins. Let's do it. You're giving me a pediatric patient? All right, where's my Red Bull? No, ma'am, I do not know why your son is gay. Because this is an emergency room. Being gay is not an emergency. Is it wine o'clock yet? Because I am too sober for this day. It is illegal to name your baby placenta. And Hitler. How can I not go home and drink after working here? Do you think they would check this water bottle for vodka? Anyone going to that concert on Saturday? What are you taking? I just had 2 McChickens and a Diet Coke for lunch and then told my patient they need to eat healthier. Come on, kid. If you're gonna smoke, at least smoke the good stuff. I'm gonna need a whole lot more than coffee after this. I'm gonna morphine up all these mofos and get a good night's rest myself. Yes, ma'am. The doctor will be in very soon.
Can I lay down next to you?
How am I?
I am dead inside.
Hopefully soon. Outside too. Hello, emergency room. Alright, what is this? 13-year-old male got drunk with some of his buddies and thought it'd be a good idea to jump out a second-story window. Cracked the back of his head wide open. This is nothing, little boy. I broke my arm when I was 10. This shit is nothing. What's his name? Joshua. He's still pretty drunk. Joshua, what are you doing drinking alcohol at 13, man? It's what we do where I'm from. We're gonna have to staple the back of your head back together. Whatever. I'm not scared. The fuck, little boy? Where are his parents? His mom was at work. She's on her way. 10-4.
Hey, Ben. Are you okay?
Yeah, I got this kid in room 3 who keeps acting like a tough guy, and I'd really love to check him.
Excuse me, I'm looking for my son, Joshua.
I'm taking care of him. Please follow me. Joshua, you got a visitor.
Who? Joshua, are you okay? Mama!
What the?
I'm sorry. Oh, I know, honey. You're okay. I didn't mean to let you down. Don't be mad. Mommy!
Hey, Austin, can you cover me in the waiting room? I'm gonna run to the bathroom.
Yeah, sure.
Thanks, dude.
There is a man masturbating in front of my daughter. Oh my god, where? That man right there. Excuse me, sir. What? You cannot do that here. I'm watching TV. There are children here. Okay, alright, I'm sorry. I'm sorry. He's doing it again! Sir! Alright, fine. Okay, I'm leaving. Alright, fine. I'm back. You won't believe what just happened. Some guy was masturbating in the waiting room. Ew. Did you kick him out? Of course. What took you so long? I was masturbating in the bathroom. What? I'm just messing with you. Thanks for covering me.
Hey, Rich, can you discharge Bed 2? The guy who's here for pain meds? I'm not gonna give him any. It's the third time this week he's been here for the same thing. Can you just discharge him? Okay, I'll try. Alright, sir, the doctor's all done. You're free to go. But I didn't get my medication yet. We're not gonna give you narcotics, man. Sorry. This is bullshit! I waited! You better get me my meds, asshole! Sir, please don't make this harder than it has to be. I want to talk to the doctor. He's not coming back. I'm not leaving until I talk to the doctor. The doctor has discharged you. He's moved on to other patients. I'm not discharged. I'll discharge on you, motherfucker.
Patient was informed he is discharged. Patient became agitated and states, quote, "You are all assholes, and someone better get me some fucking meds," end quote. Patient is also threatening to discharge on staff. Security notified, and patient was advised against discharging on anyone or anything. We'll continue to monitor.
Okay, sir, and are you on any medications? I'm a pretzel. What? No, I'm sorry. I meant, are you taking any medications? Yes, I'm a pretzel. For my heartburn. Are you saying omeprazole? Mm-hmm. Ah, okay. Got it. Anything else? I take diphenhydramine when I need it. And that's for what? Allergies. Diphenhydramine. Classic. Is that all? I'm also on hydrochloromanamide. It makes me pee a lot. Hydrochlorothiazide? Exactly. That's what I said. Well, not exactly, but you're close. Good morning.
Where am I going, Ben?
I need you both in room 2 to put a Foley catheter in an old lady. Why do you need both of us in there? Because she's completely unresponsive, and because the daughter who's also in there is a board member of the hospital. Oh. She's been giving me a headache about how to take care of her mom all morning, so I need you to go in there and pretend like you actually care. I always really care. And don't mess anything up.
Don't worry, Ben. You can count on us.
Hi, ma'am. My name is Rich. This is Austin.
We're here to give your mom a Foley catheter.
Why? What is that for? It's a tube that will drain her bladder of urine.
It'll help her pee.
Oh my god, you're gonna stick that in my mom's vagina? Well, no, we'll stick it in her urethra.
Which is right above the vagina.
But generally, yes, in the same area. Oh no, I can't watch this.
Mom, I'm gonna step outside for a minute, okay?
Please be careful with her. I've already had to yell at several nurses today. Of course, ma'am. And please tell her everything you're gonna do to her before you do it to her.
There's nothing to worry about, ma'am. We do this all the time. She's gonna be okay.
Okay, let's do it. I'll grab her legs.
Okay, ma'am. You're gonna feel my fingers and some cold cleaning soap. Now I'm gonna insert the catheter. You're gonna feel some pressure.
Did you get it?
I think so, but nothing's coming out.
Are you in the right hole?
I'm not sure.
You're in the vagina. Pull out. Try again.
I can't get it.
Dude, I thought you said you got this.
Do you want to try? I didn't bring extra sterile gloves. Just go get some. I'm not gonna leave and get gloves. It'll look like we messed up.
Is everything okay in there? We're almost done, ma'am.
What are we gonna do? Pull up a picture of a female vagina on that computer so I can see where it is. Okay. There, see? Urethra, right below the clitoris and above the vagina. Okay, one more time. Give me some lube. Come on, Austin, you got this. I got it! Yes! Finally! Okay, ma'am, we're all done now.
Does it usually take that long?
Yes, sometimes it can.
Huh, that was stressful.
Okay, daughter's back in her room.
Why do I feel like we're forgetting something?
Excuse me! Someone is looking up inappropriate female vagina pictures on the computer in my mother's room! I can't think of anything. Hi, sir. My name's Austin. What brought you into the ER today?
My foot has been killing me. I think I whacked it on something at work.
Can you take your shoes and socks off so I can see it?
Sure.
Oh, wow. It's completely bruised and swollen. How long has it been like this?
About a week now.
Have you been walking on it?
Yeah, well, I didn't think it was that bad.
It looks like it could be broken. We'll get you an x-ray.
Okay.
Hi again, sir. It looks like your foot is broken.
Really?
Yep, here's the x-ray.
Oh, wow.
You've been walking on a broken foot for a week. How have you not been in pain?
It hurts a little bit, but I have to go to work. I do construction.
You should not go to work anymore. Since this happened at work, you need to file a claim for workers' comp. I'll make a note here for you in the ER.
Whoa, slow down, Austin. Workers' comp. Are you sure? I don't want to get in trouble at work.
Sir, you need to take care of yourself. This is a serious injury. If you don't take the time to rest now, it could lead to serious problems in the future.
I don't know, Austin. What will my boss say? I'm scared, you know? I need the job.
Don't be scared, sir. You have a broken foot. It's a serious injury, and you deserve to rest.
No one's ever said that to me before. Man, I've never even taken a vacation.
This is the furthest thing from a vacation. This is workers' comp, and you need it more than anyone. Trust me.
Well, alright then. Thanks, Austin.
No problem. Now sit tight. I'll get you a wheelchair.
Oh, that's okay. I'll just walk.
No more walking!
Yes, sir.
You're a doctor? Dude, why'd you let me talk so much? You knew I was making half that stuff up. Okay, ma'am, I have your medications here. Can you make it a large and I'll take a Diet Coke?
What are you doing?
I'm ordering food. Ma'am, you should not be eating anything. You're here because your stomach hurts. And you guys are doing nothing to help. I've been here for over an hour. Look, I sincerely apologize for the wait, but I have your pain medication now. We're gonna get you feeling better. I told you when I came in here that I needed a soda. And if you remember, I said that we highly recommend, if you are actually in pain, that you do not eat or drink anything. It's gonna make the stomach pain worse. What do you mean if I'm actually in pain? What? Do you think I'm lying about my pain, asshole? No, of course not. My family runs this fucking hospital, so you better watch who you're talking to, asshole. Yes, with cheese, please.
Patient is refusing all medications and continues to have complaints of abdominal pain as she orders a large number 1 with cheese from McDonald's. MD aware. Will continue to monitor.
Okay, ma'am, and does your son have any allergies? Yes, here's a list of all his allergies. Perfect. Oh, and I know it says that he's allergic to eggs, but you could just not put that in the chart.
But is he allergic to eggs?
Yes, he is, but it doesn't need to go in his chart.
Ma'am, if he's allergic to eggs, I absolutely have to put it in his chart. It's for his own safety.
No, this is exactly what happened last time. They listed it in the chart and they wouldn't let him order any food with eggs in it.
Ma'am, do you know what an allergy is?
Excuse me?
I mean, what happens to your son when he eats eggs?
Are you trying to tell me how to raise my son?
No, I just want to make sure you know what an allergy is.
You son of a...
Attempted to educate patient's mother on the word allergy. When asked to clarify her understanding of the word allergy, patient's mother became very agitated and advised this RN to, quote, get fucked, end quote. patient resting quietly. We'll continue to monitor for changes and eggs.
Hello, welcome to the ER. How can I help you? I'm here for my son. I was picking him up from school and I noticed he's a lot shorter than some of the other kids. Okay. Is there something you can give him right now to make him taller? What are you laughing at? You serious? Yes. Is there something you can give him right now to make him taller? No. Can I speak to someone who's in charge? Hello, welcome to the ER. How can I help you? I think I'm having a heart attack. Oh. Can you tell me a little bit more about what's going on? What does the pain feel like? It feels like a heart attack. Have you ever had a heart attack before? No, but my mom has, and this feels just like it. Follow me. What the doctor is saying versus what they actually mean. Fracture, broken bone, syncope, fainting, bilateral, both sides. I will be right back. You will never see me again. What the nurse is saying versus what they actually mean. Don't be embarrassed. This happens to a lot of people. This has never happened to anyone. I still can't believe it's happening. Are you embarrassed? The doctor will be in just a few minutes. The doctor will be in give or take 1 to 3 hours. Someone will call you to schedule a follow-up appointment. Please call to schedule your follow-up appointment because we will most definitely forget to call you. Help! Guys, I need help! Sir, your arm is completely broken. What happened? Oh yeah, I need help with that too, but I need you all to cover for me.
What do you mean?
I was at my girlfriend's house and her husband came home early. I had to jump out the bedroom window so he wouldn't see us together. Ow! My arm! So what do you need from us besides the obvious medical care? I told my wife that I went to Six Flags with some buddies. She's on her way over here right now. So if she asks, I need you to tell her that I broke my arm.
Brian!
Oh my god, that's her. Brian, how did you break your arm at Six Flags? Oh, honey, I'm in so much pain. I can't talk. Could you guys please fill her in? Yeah, he was on the roller coaster and it was going up and then the seatbelt broke. Yeah, the seatbelt broke and then the drop came and he fell out.
Oh my god! Well, actually, that's not all. After falling from the roller coaster, he landed on his feet unscathed. But then that's when he realized he had fallen into the gorilla exhibit at the Animal Kingdom. You were attacked by a gorilla? But why aren't there any scratches or anything on you? Oh no, the gorilla didn't hurt him. In fact, he grabbed your husband and launched him out of the exhibit so he could be safe. Then how did he break his arm? Well, the gorilla was so strong that he threw your husband into one of the buildings outside of the exhibit, shattering it to pieces and hurting your husband. What? Is this true?
Mm-hmm. Oh yeah, definitely a gorilla throwing injury.
Wait, why are there kisses on your neck then? The building he was thrown into was a kissing booth, and he hit it right as she was about to kiss a customer.
Yeah, exactly.
Oh. Okay.
Oh my god, Brian, I had no idea my husband was gonna be home so soon. I'm so sorry you had to jump out my bedroom window.
And this is the woman Brian landed on when he was thrown into the kissing booth, who we are treating for a concussion, which can lead to false memories, and... You're not believing any of this, are you?
Brian, you son of a bitch! Hi, welcome to the ER. How can I help you? I tested positive for COVID. I feel shitty. I'm sorry to hear that. Are you vaccinated? No way, man! I'm never getting that COVID vaccine! Okay, no worries. We'll just get a temperature from you. My cousin got the vaccine and was out for a weekend. Yep, that can happen. Happened to some of my coworkers. They had to take a sick day, but other coworkers were fine. Why would you get the vaccine if it makes you sick? That's mental! Well, it doesn't make you sick. It keeps you from getting really sick, under your tongue. After the vaccine, I had some body aches and was really tired the next day, so I took the day off. See? You got sick! Why would you purposely make yourself sick? Because that's normal. Besides, I'd rather wake up with body aches than risk getting full-blown COVID. We still don't know the long-term effects of this thing yet. And I work in the ER, so I have plenty of chances. Oh, yikes. Your fever's really high. Is my chest supposed to hurt like this? No, that's not normal. That's COVID. I still wouldn't get the vaccine. Well, between me, you, and your cousin, only one of us is in the ER feeling shitty from COVID, so maybe the vaccine is helpful. You're saying I wouldn't feel like this if I got the vaccine? I'm saying it would be significantly less likely. Come on, let's get you back. Welcome to the ER. How can I help you? My 6-month-old has a fever and he won't stop crying. Have you given him any medications yet? No, I wanted you to see the fever first. How did you check his temp? He feels really hot. I know he has a fever. We'll have to check his temperature here. Can you pull off his diaper? No, I don't want you checking his temperature from his bottom. No. Why not? Because I don't want you sticking that temperature probe up my son's butt. It's weird. Sir, getting a rectal temp is the most accurate way to check for a fever in someone his age. It's very important that I don't want it to turn my son gay. Sir, this will not turn your son gay. How do you know? Did you turn out gay? What? No, I'm not gay. Because they took your temperature this way at his age too. So if it didn't turn you gay, it won't turn your son gay. Diaper off, please.
This is the right decision, ma'am.
Goodbye, Dad. What's happening? Is he okay?
Luke, who are you? This is Luke, my brother. What are you doing here?
The nursing home called me and said Dad's dying and that you're gonna let him.
Yes, we signed the DNR papers yesterday. I have it right here. No takebacks.
I don't care what that paper says. This is our dad. How can you just let him die?
Because it's what Dad wanted. Besides, the nursing home says you haven't visited in the last 8 years. What do you know?
I know Dad's a fighter. He's still strong, and he's gonna make it through this.
Oh no.
You do whatever you can to save my dad. Do you hear me?
Sir, your dad is 107 years old. If we do CPR on him now, it's gonna destroy his body.
But it might save him.
But he won't have any quality of life. He could barely see, speak, or hear.
Well, then we can teach him stuff through touch, just like Helen Keller.
You're gonna teach your 107-year-old father how to communicate through touch?
Of course not. Someone at the nursing home will.
Luke, you're being ridiculous.
You are being ridiculous. Luke.
Dad?
Dad, yes, I'm here, Dad.
Luke,
Yes.
shut the hell up and let me die, you idiot.
See, he gets it.
Welcome to the ER. How can I help you? My vagina is on fire! Oh, okay, give me 1 second. I'm gonna go grab a female doctor. No, please don't leave! You have to help me! Oh, no, ma'am, you don't have to take your pants off yet. Is that icy hot? Yes, I use icy hot on my thighs after the gym. Do you think maybe you accidentally got some icy hot down there? I don't know, maybe. What do I do? We might just have to rub it off. If you give me 1 second, I will grab a female. No, please, you can rub it off. I understand, but I am not comfortable. Just go down there and rub it off. Ma'am, I am not going down on you, nor will I be rubbing you off. And I would appreciate it if you kept your voice down, okay? I'll be right back. I really hate people. Why am I doing this to myself? These bitches are lying. Don't they know I have the test results in my hand? Fuck this shit, man. I'm gonna go work at Walmart with the disabled greeters. Just turn up his morphine every hour. He's a DNR. Como se dice, what the fuck in Espanol? They're not gonna make it. Just put the body back down first. Hello. If he wants to walk out that door and into Jesus' arms, I say we let him. Can't fix stupid. Did I say that out loud? I hope the patient moves during this MRI so I can stay here a little longer. It's nice. No screaming. How are we gonna get that thing on a stretcher? I'm sorry, what's your mom's name again? Might as well amp up the morphine. They're not gonna make it out of here anyways. Give me some too. Kidding. Okay, ma'am, there's the epidural. You should be feeling better very soon. Oh, please, get this baby out of me. Are you sure she's gonna be okay? Yes, we still need to place a urinary catheter in to keep her bladder drained. But if you put that in her, how's the baby gonna come out? What? The baby! Is there space for the baby to come out? Well, the baby will come out of a different hole. Are you sure? Will you shut the f*** up, Ryan? Okay, sir, you're being discharged. The police will be in to take you back to jail. Don't let them take me back. I'm still sick. Not according to the doctors. I'm sorry. Sir, are you pretending to have a seizure? Oh no, he's having a seizure. Austin, will you grab me the rectal thermometer? Here you go. What's it for? All patients who have seizures need a rectal temp from our designated rectal thermometer. Remember? Oh, right. I learned that in nursing school on the first day. Okay. You want to help me turn our patient? Oh, where am I? Oh, you're awake. The police are here to take you. Goodbye, sir. What were you gonna do? He didn't wake up. Get his rectal temp anyways. He's still a patient. We can always use one. Hey, I'm not feeling well. Can I borrow that? Whoa, wait! That's the rectal... Nothing. Damn. I was really hoping to go home from work. You guys have a mint? Okay, I'm here. Where am I going? Morning, Ben. I'll let you guys decide. Room 2 is an old meth-addicted lady who's just brought in by ambulance for what's likely sepsis, and room 12 is a pediatric patient, but I'll take the meth lady in room 2. You don't have to run just because I said pediatrics! This is awesome! I love kids! No, but wait! Come on! I wrote down information for you guys! Alright, what's going on? 72-year-old female found down in her apartment, A&O times 2, fever of 102, and a heart rate that's been fluctuating around the 150s. We also put her on 5 liters of oxygen. She definitely has an infection. Who called it in? Her neighbors. They also told us an interesting story about her. What, that she's a meth user? Apparently she's also a sex worker. Like, currently or in the past? Currently. It's the only way she could pay for the meth. Who would... She's 72! Some people have their kinks, Ben. I'm not even gonna think about it. Anything else? She's also got a colostomy that's looking a little funky. Oh yeah, it's really red. That's not good. Alright, we'll check it all out. Thanks, man. Hey, Doc, did you see the lab results for meth lady? Yeah, blood work's all negative. I know. What do you want to do? It's so weird. She definitely has an infection somewhere. Did you see her colostomy? I did. Definitely doesn't look normal. Do you want to culture it? May as well. I don't know what else to do. I'll do it. Thanks, Ben. What the? Oh my god. Ben, did you see the results? Yeah. Ma'am? Ma'am, wake up! Ma'am, we found syphilis and MRSA in your colostomy. Have you been using your stoma for sex? Ma'am, that is extremely dangerous. You should not be doing that! A hole is a hole. Whoa, Ben, you okay? I should have taken that pediatric patient. That pediatric patient was 17 years old, 200 pounds, and combative. Still a pediatric patient. My meth lady was letting people use her stoma for sex. Ew! Oh yeah, that's called a Philadelphia sidecar. Why do you know that? What? You guys never just get lost on the internet? No? Oh. Okay, well you should Google it. Not here though. At home. That's gross. It's not gross, it's for learning. I'm gonna go throw up. Me too. I'm just trying to give you guys information! Ugh. I
I'm so unappreciated here. Hi, Dorothy. I have your medication. Oh, be quick. I have to go. Where are you going? My father is out of town. I'm throwing a party at my house. A party? That sounds like so much fun. You should come. Am I invited? Of course. I'll be there. Who else is coming? Mark Delaney's gonna be there. He's the quarterback. Ooh, do you like him? Oh yes, I'm going to sleep with him. Dorothy! I'm going to wear my slutty pantyhose. Okay, slow down, Tiger. Let's take your medication first. Oh, be quick. I have to go. Where are you going? My father is out of town. I'm throwing a party at my house. You should come. That sounds like fun. I'll be there. Promise? I promise. Here, take this.
So we just got your results back and you are pregnant.
What? Are you sure?
Yeah.
Oh no.
The good thing is you have options. Oh, shit. Oh. Oh.
Hey, can you go help in room 2? Hey, oh my dear, it's gonna be okay. We're gonna go over all your options together, okay? It's gonna be fine. It's gonna be okay.
Alright, what do we got? 26-year-old female fell off her horse while she was training for a competition. She's got a pretty nasty leg injury.
Ah! Help! It hurts!
Okay, let me just take a look real quick. Oh, wow!
Is it bad? I've seen worse.
It's bad.
Can you feel this? Yes! Yes, that hurts!
Okay, yeah, it's bad. We should move fast.
Ow, 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 ow! Just fix it, please! Do anything!
Can you help me cut these boots off?
Like hell you are!
What?
You are not cutting into my Parlanti Roma riding boots!
Your what? You see what I've been dealing with? Good luck. Ma'am, we have to cut your boots off to see your leg.
No, just pull them off! There's a zipper!
Your leg is very swollen. If we try pulling off your boot, we risk damaging your leg beyond what it already is.
You listen to me! I have spent over $1,000 on these boots. I have broken them in for the past 5 years, and I have scrubbed and oiled them after every single ride. If you are making me choose between my leg and the boots, I would rather lose the leg. What's going on here?
She's refusing to let us cut off her horse riding boots.
Really? What kind are they? Parlanti Roma equestrian field boots?
Yes!
Oh, yeah, those are seasonal. You can't cut those off. We're gonna have to figure something else out.
What?
Patient refuses to allow staff to cut off horsey riding clothes. Attempted to educate patient that if patient's clothes don't come off quickly, hospital staff could miss an injury underneath patient's clothes, which can cause further harm to patient and potentially be fatal. To which patient replies, quote, "If I have to choose between me and cutting off my horse gear, then just spread my ashes over my horse pasture." End quote. Psych consult requested. Will continue to monitor.
I don't do well with the drama. And no, I can't stand it being fake.
Hi, ma'am. My name is Ben. What brought you into the ER today?
I'm 31 weeks pregnant and having really bad contractions.
Congrats. Baby's almost here. First one?
Yeah.
Okay, we're gonna get you up to labor and delivery right now. Is there anyone else with you?
My husband's parking the car. He should be coming in soon.
Yo, Ben, break time. Ready? I gotta take her to L&D first. Why's the floor all wet?
Oh no.
Is that?
Fuck. Did you just curse?
No. Oh my god, are we gonna have to deliver a baby? Dude, shut the fuck up. We are not delivering a baby in the ER. Why not? Because I've never done it before.
Aw, me neither. It could be our first time.
Focus, man! Right. Okay, what do we do? Ooh, I got it. Help! 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 What the? Dude! Help! There you are. I've been looking everywhere for you.
Hi, honey.
Oh, you dropped your water bottle.
I was looking for that.
Careful, you two. She dropped water on the floor. Dude, why did you freak out? I didn't freak out. You freaked out. Okay, ma'am. Is there anything else I can get you?
Do you have any tea?
Of course. What temp?
Extra hot, please. So yesterday, one of our doctors was caught making out with the travel nurse in the pediatric supply room. And they're both married. Oh my god! I know!
Austin, first day as the charge nurse. How you feeling?
Feeling pretty good. Nothing crazy so far.
Speaking of which, there was like a 10-car accident off the freeway as I was driving in.
Haha, very funny. I put you in zone 1. You have a patient in room 2.
Already? I just got here. Who put this guy in charge?
Don't worry, it's an easy one. Allergic reaction. He's here for hives.
Came to the ER for hives, huh?
He thinks he's gonna stop breathing, but I don't think he's anywhere near that. Maybe bring some epi just in case?
Don't worry, Austin the charge nurse. I'm here to make you proud.
Thanks, Rich. Okay, focus.
Hi, sir. My name is Rich. I'm gonna be your nurse today. Please hurry. I'm having an allergic reaction all over my body. Not to worry. I have your medications right here. Can I see your arm? Ow! Oh! Was that it? Nope, that was just your IV. Here is your medicine. You gotta hurry. The red spots are spreading. All done. That's it? Yep. But you only put it in my arm. I know. What about the rest of my body? I told you, it's everywhere! Oh, no, sir, that medication is in your veins. It's gonna go to the rest of your body. Even on my neck? It's on the back of my neck. I need a shot on my neck, man. What if I stop breathing? Sir, trust me, you do not need any shot on your neck. But it's on the back of my neck. What if I stop breathing? Sir, try to relax, okay? I don't think you're gonna stop breathing, but just in case, I did bring some epinephrine. Give me that! What? No! Ah! Sir, stop! Ah! Hey, Austin, could you call security for me?
What happened? Are you okay?
My allergic reaction patient may have stabbed himself in the neck with some epinephrine and may or may not be running around naked in the parking lot of the ambulance bay right now. The good thing is I think he only hit muscle and he's still breathing. Okay, thanks. I think I'm gonna go now. Bye. Charge nurse. Welcome to the ER. How can I help you?
I'm 21 weeks pregnant and I'm really worried about my baby.
Oh, okay. Let's get you up to labor and delivery right away.
Please hurry.
Really quickly, just tell me what happened.
I swallowed my chewing gum and I'm afraid it's gonna choke my baby.
I'm sorry, what?
Babies aren't allowed to eat for the first 6 months. What if he starts chewing on the gum in my tummy and chokes?
Hello? Yes, sorry, 1 second. Is there anything else going on besides the chewing gum?
No.
Great! Hey, I'll call you back. So, your baby cannot choke on the chewing gum that you swallowed.
Are you sure?
Yes, because your baby is not growing in the same part of your body as where your swallowed chewing gum is. Okay? They're in different places.
Huh?
Your baby is in your uterus, and the chewing gum that you swallowed is in your stomach. Your baby cannot get to the chewing gum. It cannot choke on it.
Oh, well that's great news.
Isn't it?
Hi, Miss Rydell. Your dad's ready to go home. All the tests came back negative and... Nobody's home? You're gone for the weekend? No, Miss Rydell, we can't... Hello? Hello?
Austin, when is Mr. Rydell leaving? I need that room.
The daughter just said she won't be home and asked if we could watch him until the end of the weekend.
What? No!
What do I do?
Call her back and get him out of here. I have 20 people in the waiting room.
Where's my daughter?
She can't make it tonight.
Oh, shucks. She's always so busy.
Don't worry, Mr. Rydell. We'll take care of you. Try to get some rest, okay? It's late. Mr. Rydell, please stop!
I gotta go! Let me go!
You can't get up. You're gonna hurt yourself.
Ugh!
Ah! No! Mr. Rydell, you're gonna fall!
Ah!
Ben, help!
What's happening?
He's sundowning. Watch his hands!
Whoa! Rich, get the restraints! Got him! Get his legs! Oh! Oh! My eye! He spit in my eye! Get his legs, goddammit! Austin, tie down his arms! I'm trying!
Thanks for helping, guys.
You need to sedate him. We can't do that without a doctor's order. Well, somebody better get one, because I'm not getting spit in the face again!
I already feel so bad for tying him down. It doesn't feel right.
It was the right thing to do. For his safety and ours. We need to start charging for elderly care. The forgetful family fee. That'll teach these ungrateful people to start picking up their grandpas.
Hi, I'm here to check on my grandfather, Mr. Rydell. Oh, hi. I'm Austin. I've been trying to reach your mom.
Yeah, where have you guys been?
Oh my gosh, I'm really sorry about my mom. She's very stressed out right now. She works all day and has to stay up with him all night. How's he doing? We had to restrain him because he was getting violent. That's been happening a lot more. We don't know what to do. We understand. It's not easy.
But this situation isn't sustainable either. We can't keep him here forever. He needs to go home.
I don't know how to take him home.
It's not safe to take him in the car. We'll arrange for an ambulance to take him home, but he needs a full-time caregiver.
I try to be there when I can. We've been trying to get him into a good nursing home, but the waiting list is always so long, and it's really expensive.
We'll give you some resources. It may not make the wait list go any faster, but it can help with the cost.
Mr. Rydell, your granddaughter's here to take you home.
Oh, thank you. You've been very kind.
It's our job, sir.
What happened to your hair?
It's really not easy getting old, is it?
Nope, not at all. Least we could do is try to make it easier. And if not, there's always the forgetful family fee. Hey, Doc, are you going to order CT scans on any of these patients? Which ones? How about the 65-year-old with head trauma? No, I don't think it's necessary. Okay, then what about the patient with an elevated D-dimer? They could have a blood clot. No, I don't think so. Okay, what about our stroke alert patient? She came in with classic stroke symptoms. I think she's going to be fine. Can you just make sure to get a CT scan on the patient in room 2? Room 2? The girl who came in because she thought she was pregnant? Yeah. Her pregnancy test came back negative. She's fine. Yeah, but she vomited like 3 months ago. And she's got some pain. Pain where? Just in general. You've got to be joking. She's the only patient that you haven't even physically seen yet. Oh, no, you're right. I made a mistake. Thank you. Add contrast. No. Mr. Sauvignon Blanc, come on back, sir.
Excuse me, but I was here before him.
Right, but I don't know if you saw. He's in pretty bad shape.
I don't feel well either. I fainted twice today already, and it almost happened again just now. Do I not count?
Ma'am, it's probably a good thing you're not being rushed back, don't you think?
I'd like to speak to a doctor right now.
We're gonna try to get to you as soon as we can, okay?
Oh, we'll see about that.
What are you doing?
911? Yes, I need an ambulance.
Seriously?
I'm at the emergency room at 5th and Vigil.
Ma'am, even if you come back by ambulance, we're gonna put you in the waiting room.
I know I'm here already, but they won't see me. I need you to bring me back right away.
Just give me 1 second, okay?
Well, then I'd like to speak to your supervisor.
Ma'am, do you think you could take this phone call over there?
I would like to speak to your supervisor as well.
You got it. Just have a seat first, please.
This is ridiculous. Do you hear me? Ridiculous.
I know. Have a seat, please. Hi, how can I help you? Oh, incoming. See ya. Oh, fuck. Hi, Miss Jameson.
Sir, I would like to see a doctor now.
Right. It's pretty busy back there. We're trying to get you in as soon as we can.
I have been waiting here for nearly 2 hours.
That's actually not too bad. No?
I want to see a doctor or I'm leaving.
Really? I mean, no. Ma'am, I am advising you to stay. For your own safety.
But also, if you wanted to leave, I cannot physically stop you. Well, how much longer? I want to know how much longer or I'm leaving. You know, it just depends. If ambulances come, how long it takes people to leave, what the doctors are doing, you know, probably having sex in the closets, right? So you don't know. It should be soon. Goodbye. Okay. And thanks for nothing, stupid! Miss Jameson? Oh, she just left. So close. Okay, sir, my name is Ben. Can you explain to me what brought you into the ER today? My house was in a mess, so I needed to use the vacuum cleaner. So while I was vacuuming, I started to, build up a sweat. Okay. I turned on the AC, I opened up the windows, yet it was still incredibly warm. Okay. So I decided, of course, to remove some of my clothing. And it was still so hot that I removed the entirety of my clothing. You were naked using the vacuum cleaner? Yeah, right. So, I got so tired from all the vacuuming that I decided to take a nap. You went to bed? Well, I was so tired that I thought instead of going all the way up to bed, I could just sleep on the couch. Even better, sleep on the floor. The floor. Yeah, so, I was sleeping naked on the floor next to the vacuum cleaner, but it was still on. Was the vacuum cleaner not making a lot of noise? Were you able to sleep with it on? Well, it's one of those silent vacuum cleaners. You should get one. They're amazing. So what happened next? Well, I was moving around while I slept, and then suddenly my genitals accidentally slipped into the vacuum cleaner. And that's why they're there now. Huh. Okay. Well, the doctor will see you soon. Thanks. It's good to see you again.
Welcome to the ER. My name is Ben. How can I help you?
It really burns when I pee, and I have a stomach ache.
We'll need a urine sample from you. Can you give us one now?
What do you think it is?
It's probably a UTI. Are you having any abnormal discharge?
Yes.
It could also be an STD.
Ew, oh my god, no! There's no way!
Are you sexually active?
Yes.
Okay, then maybe we shouldn't rule out an STD.
I do not have an STD. I would know, so stop saying that. It's gross.
Uh-huh.
What?
Nothing. Let's just run the test.
1 hour later.
It's an STD.
That's impossible! Run it again!
I'm not gonna run it again.
That test is wrong!
Why are you so sure you can't get an STD?
Because I've only ever had sex with one person, my boyfriend.
And?
And we were both virgins before we got together.
So?
So it's impossible that I got an STD from him.
None of that makes any sense.
I need you to run that test again.
And I need you to call your boyfriend.
Run it again!
No.
Hello, welcome to the ER. How can I help you? This is my daughter, Sarah, and she's bleeding a lot from, between her legs. We're gonna get you seen right away, okay? Sir, would you like to come back with her? Oh no, I'll wait here. So it looks like your daughter is actually having her first period. What? Is she gonna be okay? Yep, she's gonna be fine. It's actually very normal for her age. She didn't lose too much blood, did she? Nope, she's perfectly fine. We're actually getting her discharged right now. Oh my god, thank you. I was so worried. How do we stop this from happening again? You don't. Hello, welcome to the ER. How can I help you? I got shot in the leg. Oh my gosh, someone shot you in the leg? I was putting my gun back in my pocket, and it went off.
You shot yourself in the leg. Yeah, it was an accident. But this is an ER. Don't you see this the whole time? No.
Hi, sir. My name's Austin. What brought you into the ER today?
I got a really bad cut on my hand. Pretty sure I'm gonna need stitches.
Oh, wow. That definitely looks like it's gonna need stitches. What were you doing?
Trying to make dinner for my kids.
You're in a good mood for someone who needs stitches.
Hey, these things happen.
I'm afraid I'm gonna have to ruin the mood. The wait time's gonna be pretty long. We're super busy.
That's okay.
Really?
Yeah, don't worry about it. I'm an ER nurse.
Oh, that makes sense now.
I get it.
Okay, well, we'll definitely try to get you back as soon as we can.
Thanks, bud.
Alright, you're all done. Stitches look good, and I have your discharge papers right here.
That was really quick. Thanks, Austin.
Well, you were still here for 2 hours. Sorry we couldn't get to you sooner.
It's all good, man. But hey, can I ask you something? Can I get a pair of those sterile scissors to cut these stitches off myself at home so I don't have to come back?
Way ahead of you. I got them right here.
You're the man.
Have a happy new year.
Thanks. You too. Okay, Mr. Malibu, the doctor will be in to see you shortly, okay? Wait, my man. My girlfriend is in the waiting room. Can she come back to see me? Her name is Abigail. Of course. My wife is also on the way to see me. If you see her, can you tell her I'm not here? Why wouldn't you want her to know you're here? She doesn't know about my girlfriend. I don't want them to meet. I see. And what do you expect me to tell her? Just tell her I'm not here. Or tell her you transferred me or something. You know, make something up. What does your wife look like? Is she about 5'2", blonde, curly hair, wears glasses, talks too much? Got it. I'll let her know you're not here. Solid. Thank you, brother. No problem, brother. Hey, Austin, if Miss Malibu shows up, 5'2", blonde, curly hair, wears glasses, just send her straight back to Mr. Malibu's room, okay? He's expecting her.
Got it.
Cool. Abigail? Follow me, please. Alright, what do we got? 42-year-old female found lying on the floor for the last 2 weeks. Her husband said she fell down and he couldn't get her up because she's 450 pounds and has lymphedema. Oh my god. What made them finally call you guys? Well, turns out he was visiting her today and she said the sores on her back were becoming too painful. What? He doesn't live with her? Nope. Just comes by once in a while to bring her food and change the towel between her legs. Towel? What do you mean towel? Well, she can't get up to go to the bathroom, so... towel.
Oh. Wow.
Oh yeah, it took about 6 of us to scrape her off the floor and get her here. We had to cut the carpet underneath her because she was growing into it. Okay, I've heard enough. Room 1. You got it, boss. Red team, room 1, let's go! Hello, sir. How can I help you? I was having a really hard time breathing earlier. It was really freaking me out. Are you still having trouble breathing? No. I actually feel a lot better now that I'm here. Oh, great. What do you think it was? Could have been a number of things. Maybe a panic attack? The important thing is, you're fine now, and you can go home. Do you think maybe I could still get checked out? For what? I mean, I drove all the way over here already, you know? Might as well see a doctor. Are you guys busy?
Does anybody know how much longer I'm gonna have to wait?
Ayúdame! Ayúdame!
Ah! Mommy!
To infinity and beyond!
All eyes on me. Horrified looks from everyone in the room.
You have been promoted. You are now one of my elite employees.
If one more person tries to die before I clock out, I will quit. I wish housekeeping stocked pillows so you could smother me with one. Management thinks they're gonna fix my mental health with a pizza party? Ha! Tell them to shove that pizza up their... You hear that person screaming? That's me. On the inside. There's pizza in the break room? Right now? Who wants to push me off the helipad? Is there barbecue chicken? Welcome to hell! Did I shower yesterday? Pretty good. Oh no, I still hate management. How much time off do you think I'd get if I rolled this gurney over my foot? I will burn this place to the ground. Oh, hi, welcome to the ER. How can I help you? Alright, what do we got? 36-year-old male found down in the middle of a park. We suspected an overdose, gave him some Narcan, and well, he woke up. Let me out of these! We also put him on 4-point restraints. Ah! I see that. Sir, do you remember what happened? Where's my stuff? If you lose my things, I'll sue you! We have your things right here, Bob. He's 8 times 4. Perfect. Hey, Bob, I'm gonna be your nurse. If you could try to relax, I don't see why we can't take these restraints off you. Deal? Let me go! Ah! Bob, can you look at me? I'm just trying to help. You look like a stupid piece of shit! Get fucked!
Patient aggressively advising this RN to, quote, get fucked. I'll kill you if I ever get out of these restraints, end quote. RN advises patient that patient's statements go against hospital policy on creating a safe work environment. Patient again informs this RN to, quote, get fucked. RN declines. Medication requested. Will continue to monitor.
Hello, welcome to the ER. My name is Rich. How can I help you? It really burns when I pee. I think I have a UTI again. You said again? Do you get them pretty often? Uh-huh, I do. Are you sexually active? Yes. And are you making sure to pee after sex? It can help prevent UTIs. Oh, I always pee after sex. I don't want to get pregnant. What? I said I don't want to get pregnant. Peeing after sex does not stop you from getting pregnant. I'm pretty sure it does. No, listen to me, okay? You pee out of a hole called your urethra. You have sex with your vagina. They are not the same. They are two different holes. You do not pee out of your vagina. I have 2 holes? Yes, and the only way you're not going to get pregnant is if you use protection. That's not what my boyfriend says. Well, your boyfriend's wrong, okay? And you could be pregnant right now. Babe, I'm here. Is everything okay? Babe, this nurse says I could be pregnant. There's no way. Did you tell him you pee after sex? She pees after sex every time. I make sure. No, babe, I have 2 holes. I know, vagina and butthole, but I'm only allowed to use one. Oh my god. No, babe, I have another hole called the urethra. Babe, if you had a 3rd hole, I think I would have seen it by now, right? I don't want to brag, but I also have like a mad good pull-out game, so I'm gonna go ahead and guarantee she's not pregnant. Okay, I'm gonna start over. Both of you, sit down. Girls have 3 holes. Ben, Austin, I got new patients for both of you. Oh, come on, Rich. I'm already fucking drowning. I know, but we're busy. ER don't stop for no one. What do you got? Ben, you're getting an old lady with a cut and bruise on her head. She came from the nursing home and apparently hit her head on a bed rail. I saw her in the lobby. Did she try to swing at you? Yep, dementia, confused, and combative. Good luck, Ben. Fuck! Austin, you're getting a nurse from the same nursing home here for a busted hand. They're both in their rooms. Remember to smile. Goodbye. Fuck! I'm gonna go check on my patient. Hi, sir. My name's Austin. How did you hurt your hand? I accidentally hit a table. You hit a table? Yeah, I hit a table. What's with all the questions, man? Come on, I gotta get back to work. Huh. Hey, Ben, I think that nurse punched that old lady in the nursing home. I don't have time for this, Austin. Go tell somebody else. Hey, Rich, I'm pretty sure that nurse punched that old lady in the nursing home. Oh, yeah. You're probably right. Should I report it? You could. It's actually pretty common. That's horrible. Yeah, you're gonna learn a lot of horrible things about the world working in the ER. Try not to let it change you for the worse. Ooh, new patient. Get ready. It's coming to you. ER don't stop for no one. Fuck! Welcome to the ER. How can I help you? I, have a foreign body object stuck in me. What? Where? Up my rectum. Oh, okay. Oh. What is it? Easter egg. Gotcha. Happy Easter. How did this happen? I was doing an Easter egg hunt for my nephew and I fell on them. Them? Yeah. How many did you put up there? 12. And how many are stuck? Like 5. Oh, wait. 4. Have a seat. We'll call you in soon.
I can't sit.
Just stand over there, man.
What do I do with this?
Take it with you! Hi, sir. My name is Rich. What brought you into the ER today? I have neck pain. Okay. And on a scale of 1 to 10, how bad is that pain right now? 10. 10? Yeah, 10. Are you sure? It's really bad. I could barely move my neck. Okay. I'll be right back. Hey, Austin, how's your patient in room 2 doing? Not good. His leg is definitely broken and he needs surgery ASAP. It was a crazy car accident. I'm still trying to wash the blood off my hands. Perfect. What? Okay, sir. Follow me. This is your room right in here. Ah! Help! My leg! Ah! Oh my god! Oh, sorry. Wrong room. Wrong room. This way. This way. This way. This way. This way. Sorry. Was that white thing his bone sticking out of him? Yeah. Painful, right? Yeah. So going back to your chart here, on a scale of 1 to 10, how bad is your neck pain now? Definitely not as bad as that last guy's. Really? I guess it's about a 9. Seriously? No, you're right. 9.5. What the f-
Hi! I need some help!
Hello, ma'am. How can I help you?
It's my eyes. There's really bad spots all over my vision, and it's really painful.
On a scale of 1 to 10, how bad would you say the pain is?
Like an 8. I'm pretty amazed I drove here, to be honest.
We're gonna get you in and get your eyes examined right now. Hi, ma'am. I'm back. So it looks like you have fairly severe black ringed burns on your retinas.
Oh my goodness!
Have you been doing anything unusual with your eyes or putting anything in them that may have caused this?
Well, I do stare at the sun for about 10 minutes every day.
What? Why?
Oh, I know that must sound weird out of context.
What context would make it normal to stare at the sun?
Well, I have natural healing abilities, so I have to stare at the sun for 10 to 15 minutes a day, minimum, to charge my healing gift.
Excuse me?
Let me explain. The eyes are the main access points to the soul, so staring at the sun allows me to absorb the energy I need to realign my chakra.
Okay, stop doing that immediately.
Well, no, my chakra needs it, but I see why you may be confused, because you've been brainwashed by the brick-and-mortar medical industry. You see, for a healer...
You're going blind!
Well, what do you suggest I do then?
I suggest you stop staring at the sun and go directly to an optometrist to see if you have done permanent damage to your retinas.
I think I'm gonna need a second opinion. I'd like to call my friend Alan to be sure.
Is Alan a doctor?
Yes!
Okay, fine. Call him.
A witch doctor.
Oh my god!
Hi! I'm back!
Welcome back, ma'am. Ma'am, I'm over here.
Oh, sorry.
Did your vision get any better?
No, worse actually. And I did everything you, the optometrist, and my doctor friend told me to do.
I see. Okay, tell me exactly what you did.
Well, you said to stop staring at the sun, so I did that.
Great.
My optometrist prescribed me eye drops, and even though they totally weren't natural, and normally I would never, I applied those twice a day like he said.
Okay, fantastic.
And my witch doctor Alan told me to go into tanning booths with my eyes open, so I started doing that.
Okay, great. What?
Well, you said to stop staring at the sun, but I still needed to charge my healing gift. So Alan and I talked it over and we decided that tanning booths were like the best of both worlds.
Why would that be the best of both worlds?
Because it isn't the sun, but it still has all the elements of the sun.
Yes, but the elements of the sun are what's making you blind!
Agree to disagree.
Patient is a self-appointed natural health influencer who came into the ER after experiencing partial blindness as a result of staring at both the sun and the inside of tanning booths. When advised to stop, the patient questioned my medical background and attempted to sell me her 10-week online health and healing medical crash course to becoming a, quote, healer, end quote. Education provided. Site consult requested. Will continue to monitor.
Hi Hi, sir. Welcome to the ER. How can I help you?
Listen, I know you're not a vet, but I need you to look at my dog right away.
Oh, I'm sorry, sir, but we're not really qualified to look at animals.
Please, the vet ER is too far away. He's got this weird growth on his abdomen. It came out of nowhere. I'm scared it might be cancer.
Oh, sir, we really shouldn't... Wait, show me that growth again?
It's right there.
That thing right there?
Yeah, am I right? Is it cancer? Oh my god, it is, isn't it?
You said it appeared out of nowhere one day?
Yeah.
Are you sure?
Well, not entirely sure, but...
Well, my guess is that it's always been there.
Really? Why?
Because that's your dog's nipple.
What?
Yeah. See, if you look closer, there's actually about 8 of them underneath his fur.
But that's impossible.
Why is that impossible?
Because he's a boy, of course.
Sir, boy dogs have nipples too.
What? No, they don't. What they?
Do you have nipples, sir?
Yeah.
Okay, well, same thing.
Huh.
Yeah.
So my dog's fine?
Yeah, the dog's fine.
Wait, but if the dog has 8 nipples, how come I only have 2?
Hi, do you work here?
Yes, how can I help you?
Well, I don't know how to put this politely, but, my vagina burns like hell.
Okay, do you remember when it started?
About a week ago, I was feeling some pain and discomfort, and burning when I pee.
Have you had a UTI before?
See, that's exactly what it said online. Some sort of infection.
Don't worry, just pee into this cup and we can figure it out.
Well, actually, I had also read online that tea tree oil is good at fighting infections.
Oh my god. You didn't put tea tree oil inside of you, did you?
I did.
Okay, don't worry, as long as it wasn't that much.
I soaked a tampon in tea tree oil and stuck it up there.
What?
After day 3, the pain became unbearable.
How long did you leave it up there for?
6 days.
Seriously?
At first I thought the burning was helping, but now I think I really need help.
Look, everything's gonna be fine, okay? Just have a seat and we'll call you in as soon as we can.
Shouldn't we try to get the tampon out as soon as possible?
It's still inside of you?
Yes.
Oh, someone get me a room!
It burns.
Things people with dementia have said in the hospital.
It's a shame you're so ugly. You could have been a model. I want my titty milk. I'm going to kill you. You're wiping my ass. I bet your mother is real proud of you. The devil made me do it. I didn't mean to kill them. I promise. You're a whore for sleeping with my husband. I'm a police officer. I'm not on the run. I'm chasing someone. You're a bossy bitch. I keep trying to get away from my kids, but they keep finding me.
While talking to their own kids. Which is your favorite?
Okay, sir, my name is Richard. I understand your girlfriend here doesn't speak English, correct? Yeah, but that's okay. I could translate. So I'm afraid she has a very mild form of chlamydia. What? She has a very treatable form of chlamydia. It's an STD. I know what chlamydia is. I'm not telling her that. Why not? She could have got it from me. Do you have chlamydia? I had a wild weekend in Vegas a couple months ago, okay? I don't know what happened, but I need whatever happened in Vegas to stay in Vegas, know what I mean? Can you please just tell her? Fine. Estás bien. Did you tell her? Yes? Then why is she smiling? What? She looks really pleased to have contracted chlamydia. She's a very optimistic lady. I don't think you told her she has chlamydia. I don't think that's any of your business. Will you please just tell her? She just needs to take some antibiotics and she'll be fine. Fine. Just one last question. What? Can you double the antibiotics? And can I get an ice pack for my face? She got a mean left hook. Hi, sir. My name is Ben. What brought you into the ER today? I have a really bad rash on my genitals. It's not going away. I am gonna need to take a look at it. Can you pull your pants down? Yes. Oh, wow. It's really inflamed. When did this start happening? About less than a week ago? Okay, it looks like an STD, but have you been doing something to it? It looks really bad. I've been spraying Clorox on it. Did someone tell you to do that? I don't know. I just panicked. Okay, that's alright. Do you know who you might have gotten this from?
My wife.
Okay, does she want to come in and get checked out?
No. She's out of town. It's just me.
Is she also spraying Clorox on herself?
I don't know. Yes. I'll tell her to stop. Listen, can you please not report any of this? I'm a priest and I'm not supposed to be married. It would be really bad if my church found out.
No, of course not. That's against the law. We're just gonna make sure you're okay.
Oh, okay. Good. Thank you.
Follow me. Hey, Rich, I just had the weirdest patient interaction.
Me too!
You first. Get this. The patient I have is a hooker with genital herpes. Checks out.
But she's been spraying Clorox wipe on it, thinking it'll go away.
What? Who told her to do that?
The guy she slept with, who just happens to be
a priest?
Yeah. How'd you know that?
Lucky guess.
Hi, welcome to the ER. How can I help you?
This is my wife. She's 22 weeks pregnant and she's having pain on her left side.
Honey, it's not that bad anymore. Relax.
What if something's wrong?
It's gonna be okay. You guys are here now. We'll get her checked out. Let me just call my labor and delivery team.
Wait, before you go, can I ask you a question?
Honey, stop it. I'm fine. Of course. What's your question?
My wife, she was eating spaghetti earlier and, I don't know. Do you think that could hurt the baby?
Why would that hurt the baby?
Because spaghetti's long and the baby can't be that strong, so do you think it might have strangled the baby or hindered its breathing?
Oh. No.
Are you sure?
Mm-hmm.
How do you know?
Well, because the baby is in her uterus. It's a different part of your wife's body than where the spaghetti goes. Spaghetti goes to the stomach. It won't touch the baby.
Oh, thank God. Oh, thank you. I was so worried.
Thank you. I'm so sorry. Oh, that's okay. I'll be right back. Hi, Mom! Are you ready to make a birthday? You don't want the epidural? I think you're gonna regret that. There's gonna be no problems with delivery for that one. It's her 5th. It's gonna look like this. Oh, honey, don't worry. I haven't shaved either. Look, I'll show you. Push like you're pooping. Push like you're pooping. Can you actually try to keep it down a little? You're scaring the other mothers. It's okay to poop, I promise. Shitting yourself is normal. For the woman, not the man. Your husband really doesn't have to be here. We can escort him out. You got this, bitch! Alright, head's coming out. Pose for a pic. I can't tell if it's you or the baby, but I think it's got a full head of hair. I see testicles! Kinda smells like barbecue. Oh, it's a little mango baby, all covered in salsa. Were you expecting a biracial baby? Get security. We might have a who's the father problem. Hey, wanna see your placenta? Hey, Austin, can you help me in triage? I'm slammed right now. Yeah, who's next? Some kid got a penny stuck up his nose. A penny? Wow, that's a first. I put him in room 1. Thanks. Hello, my name's Austin. I heard someone got a penny stuck up their nose. It's okay, Josh. They're gonna help you. It's my son, Josh. I don't know how he did it. I'm so sorry. It's okay. Kids get things stuck in their nose and ears all the time. You'd be surprised what we've seen. Although, a penny is pretty impressive. I feel terrible. I know you guys are busy with a million other things. It's perfectly okay, sir. Trust me. We'll just pop it out and you guys will be out of here in no time. That sounds great. Thanks, Austin. Austin, can you help in triage? Someone got a penny stuck up their nose. Oh, I already heard that. What are you talking about? They just checked in. What? Oh. Hi, sir. Is everything okay?
I got that penny stuck up my nose.
What? How?
I just wanted to see how he did it.
Ah.
I'm sorry.
That's okay. Come on, follow me.
Welcome to the ER, sir. How can I help you? I woke up this morning with some back pain and was just wondering if you guys could check me out and see what's going on. Of course. Can I just first ask you how much pain you're feeling on a scale of 1 to 10? Sure, I guess it'd probably be like a 5. A 5, okay. Just have a seat here, fill out this paperwork, and we'll call you in as soon as a room is available. Oh, okay. Will it be a long wait?
Rich, we have a patient who's just been in a horrible car accident. Their arm is completely broken and I think they ruptured a lung.
Okay, quick, bring them into room 2 right away and I'll send someone else in there to help you with them.
On it!
Hey, I was here before that guy. He didn't even have to fill out any paperwork. Well, I mean, that's clearly an emergency. Where did he say he was at on the pain scale? On the pain scale? Yeah, where was he at? Well, we didn't ask him, but if the blood and screaming was any indication, I'd say it's pretty high. Okay, I see what's going on here. I want to change my answer. Sir, you can't just change. My back pain is a 10. You just told me it was a 5. Well, I guess that means it's getting worse, doesn't it? In fact, I think it's getting worse. Oh my God. It's at an 11. It's breaking the pain scale. Okay, sir, you've made your point. Ben, can you help this patient into a room soon? He's experiencing pain levels of 11. What? 11? It hurts. Yeah, I can get him in right now. Follow me, sir. Oh, great. Thank you. Okay, sir, can you tell me where you're feeling this 11 out of 10 pain? Yeah, my lower back is kind of achy. I think I lifted a box wrong or something. I thought you said your pain was at an 11. Yeah, it really hurts. So this is the worst possible pain you could ever imagine. So much pain that you literally broke the pain scale. Okay, maybe a 10. So you still think this is the maximum amount of pain you could possibly be experiencing? Fine, it's a 9, but I won't go any lower. I'm not asking you to go any lower. I'm asking you to be honest. You're obviously not feeling a 10 right now. Okay, if we're being honest, the pain has gotten a little better, so it's looking more like a 6. So let me get this straight. Your pain started at a 5. Then when you couldn't get a room, it shot up to an 11. Now that you're in the room, it's back down to a 6. Should I be expecting any more convenient changes to your pain levels? That depends. What number do I need to say to get some Vicodin? Welcome to the ER. My name is Ben. How can I help you guys?
This is my girlfriend. She's not feeling well. Will you please stop yelling and just get me a bucket so I can throw up?
When did this start happening?
This morning. My stomach also really hurts.
Any chance you could be pregnant?
No.
Are you sexually active?
Yes.
And are you using birth control?
Yes.
Okay, we'll find out what it is, but we're gonna do a pregnancy test in the meantime, just in case.
Fine, whatever.
2 hours later.
You're pregnant.
What? How?
Birth control isn't always 100% effective. What type are you using?
The Nuva ring. I've been using it for months.
Why is it on your wrist?
Where else is it supposed to go?
It's supposed to go into your vagina.
What? Nobody told me that!
You didn't have to talk to a doctor or a pharmacist when you picked it up?
I bought it online.
Wait, if hers goes in her vagina, where's mine supposed to go? Why do you have one? If we both use it, doesn't that mean we have double the protection? No! It only works if it's inserted into your vagina!
How do we have sex if it's in my vagina?
It doesn't interfere with sex. You put the ring in, and after 3 weeks, you take it out. You have your period for about 7 days, then you put a new ring in, preferably at the same time every month.
Oh.
So the ones on my ankles, those are useless too? Okay, ma'am, so it looks like you are being admitted to the hospital. I just need your consent on some of these forms and we'll get you upstairs.
Consent? For what?
Standard questions, like in the event of an emergency, would you accept blood if it was needed?
Oh, no.
Oh. Okay, is there a reason why?
Well, do you separate your vaccinated and unvaccinated blood?
No, that's not something we know about our donors.
Okay, then what blood alternatives do you offer?
Blood alternatives?
Like cow's blood or pig's blood?
Ma'am, you can't even get the wrong human blood, or you'll have a reaction and die, let alone animal.
I'm not asking for human blood. I'm asking for blood alternatives.
You know, now that I think about it, we do have some blood from a bat that came in from a Wuhan wet market back in 2019. Would you like some of that?
Of course I would. Everyone knows COVID was fake.
I'm just gonna check no to the blood thing. Alright, what do we got? 38-year-old male hit by a car while walking around naked towards oncoming traffic in the dark. Seriously? 2 in the morning? We're pretty sure he's high on crystal meth. Ah, gotcha. How's he doing? His leg is pretty messed up, his vitals are stable, and he's in a pretty decent mood. Alright, I'll go say hi. Thanks. Hi, sir, I'll be your— Whoa! What are you doing? What does it look like I'm doing? Sir, please stop touching yourself. We're at a hospital. Fuck off, my leg hurts. Sir, there are families here. This is inappropriate. You have to stop. I said fuck off, bitch. My leg hurts. It's helping my pain. Sir, come on!
Patient arrived by ambulance and observed aggressively self-stimulating. When asked to refrain from inappropriate behavior, patient states, quote, "Fuck off, bitch. My leg hurts. It's helping my pain." End quote. PRN pain medication requested. Will continue to monitor from afar.
Hello, my name is Ben. What brought you into the ER today?
I got shot, bro.
Oh my god, where?
Right there.
Your foot?
Yeah, bro. Life on the streets ain't easy, know what I'm saying?
I'm gonna unwrap it. We gotta take a look, okay?
Been doing too much gangbanging, bro. But I ain't gonna say who done it, cause I ain't no snitch, bro.
Got it.
I'm from the hood. We live by the code.
It looks like the bullet entered the top of your foot.
Yeah, bro. Those chumps are shooting from behind. Cowards.
You're saying the bullet came from behind you but hit the top of your foot?
Yeah, bro. It was some Matrix shit where it came from behind, swirled up my leg, and hit me from my upper foot.
That's impossible.
No, it's not.
It actually looks like the bullet came downward onto the top of your foot. Sir, did you shoot yourself in the foot by accident?
I told you already, bro. I ain't no snitch.
Okay.
Okay, sir. Last thing is, we just need a urine sample from you.
Oh, okay. Bathrooms are right over there, and I'll be waiting outside. Austin, what are you doing?
Just monitoring my patients. What's up, Rich?
Nothing. Just waiting for my guy to come out of the bathroom. Whoa. Your bed 10's heart rate's going up.
Oh, that's weird. He was fine just a minute ago. I should go check on him.
I'll do it.
Are you sure?
Yes, I'm bored. Let me know if my guy comes out of the bathroom. Hi, sir. Is everything okay?
Whoa, man! Don't you know how to knock?
Oh, I'm sorry. Is everything okay in here? Yeah, why? Well, your heart rate was going a little faster than normal, and we just wanted to make sure nothing was wrong. Oh, I was watching a scary movie. Your TV isn't on. I turned it off. It was pretty scary. Okay. Well, just let us know if you need anything, okay? Well, that was weird.
What was he doing?
Nothing. He was just laying there.
Well, his heart rate's back to normal.
No, it's going up again.
What the?
Sir, are you sure you're not feeling— Oh my god! Oh my god! Hey, come on, man! Give me some privacy!
Rich, what happened? Why were you yelling?
He was masturbating in his room.
Ew! Who would masturbate in the emergency room?
Right?
Hey, sorry that took so long. There you are! I was wondering if you were ever gonna come out. I'm usually not comfortable doing this unless I'm at home. Did you have to poop? No, I didn't have to go to the bathroom.
Why is your urine so white?
Oh my god, that's not urine!
Oh, you needed a urine sample! Oh, that would have been much faster. Welcome to the ER, you two. How can I help you? Yeah, my girlfriend's stomach's been hurting her. Can you check her out? Of course. Ma'am, can you please tell me your name and exactly where your pain is? Whoa, dude, I'm right here. You're just gonna cut me out of the conversation like that? What? I'm the one who brought my girlfriend in and now you're gonna act like I just don't exist? That's kinda disrespectful, huh? Sir, these are just standard questions we ask everyone when they come in, and since the lady is the one in pain, I figured it'd make the most sense to get the information from her. Hey, who you calling lady? You trying to be flirty? What? No! You see this shit, babe? The ER guy's trying to get close to you. Thank God I was here. Who knows what he'd be doing to you right now? I'm not doing anything! You know what? I'm not gonna deal with whatever this is right now, okay? Let me just find someone to get you guys into a room.
Hi guys, my name is Austin. I'm gonna be helping you today. Now, ma'am, you said it was the side of your stomach that was hurting you? Yes. Okay, I'm gonna put some pressure here. You let me know when it starts hurting you, okay? Any pain yet? No, not yet. Okay, how about here?
Yo, no, that's enough.
I'm sorry?
Let me ask you something right now. Are you gay?
Am I gay?
Yeah, are you gay?
Well, sexuality is on a spectrum, but... Wait, that's none of your business. Why are you asking me if I'm gay?
Because you're getting awfully personal with my woman here.
Oh, no, sir, I'm just trying to diagnose the problem. You see, if the pain is greater on this side...
Nah, not today. Come on, babe, we out of here.
But sir, what if your girlfriend needs immediate medical care?
Then I guess we won't know until we find an entirely homosexual emergency room then, won't we? Come on, babe, let's go. You're gonna have to pop another Advil in the car and hope it's not like an appendicitis or something.
You mean appendicitis?
All these doctors is perverts.
I'm actually not a doctor.
Pervert. I'm gonna tell you 3 patient stories. 2 are true, 1 is a lie. I was at the nursing station watching the patient monitors when I noticed one of our patient's heart rate was going a little faster than normal. I went to check on him, but he was just laying in bed watching TV. Everything was fine. But as soon as I sat down, it started going fast again. I went to check again, and turns out he was masturbating. I was too, but I wasn't hooked onto the heart monitor, so nobody knew. Patient number 2 came in via ambulance for classic textbook heart attack symptoms. The ER was pretty worried, so we worked him up right away, but we couldn't find anything. No less than an hour later, he was missing from his bed, so I went to go look for him. I found him in the hallways of the hospital at the vending machines, getting a snack. Lying son of a bitch. Patient number 3 was in the trauma room because of an accident. And when you get into a physical traumatic accident, the doctor has to check your rectal tone via rectal exam. So the doctor stuck a finger in him and the patient said, "I'm not sure if I feel anything. Can you put 2 fingers in?" Which is the lie. Welcome to the ER. How can I help you?
I want to get checked for type 2 diabetes.
What?
I think I got type 2 diabetes. I need to get checked.
Did someone tell you you have diabetes?
No, not yet.
Why do you think you have type 2 diabetes?
I had a lot of ice cream 20 minutes ago, and my body started feeling really weird.
And
I want to get checked.
Sir, it is 2 in the morning.
Hi, sir. My name's Austin. What brought you into the ER today?
I'm a homophobe. I need a female.
What?
I said I'm a homophobe. I need a female.
Sir, why don't you just let me know why you're here first, and then I'll see what I can do.
I need to get checked for testicular cancer.
Really?
Yes, and I need a female doctor.
Because you're a homophobe.
Because I'm a homophobe, right.
Sir, there are no female doctors here at the moment. You're gonna have to be seen by a male doctor.
That's bullshit!
And I can tell you right now, even if we had a female doctor, I wouldn't let her anywhere near you.
You're being unfair, man!
Well, life's unfair. So what do you want to do?
Forget this! I'm out of here!
Unbelievable. Rich, you would not believe this patient that just walked out on me. He wanted a female doctor to check for testicular cancer because he's a homophobe.
Oh, that's Gary.
You know him?
Yeah, did you check his testes?
Ew, no!
Oh. Yeah, me neither. But he definitely has testicular cancer. Alright, what do we got? 46-year-old male with burns to his lower extremities. He had been trying to use a propane-powered weed burner in his yard, and well, things got a little out of hand. What the hell is a propane-powered weed burner? Think of it like a flamethrower. Seriously? Best way I could describe it to you. It ain't a flamethrower, morons! Sir, are you in any pain? What does it look like, asshole? As you can see, his shoes are charred and the bottom of his pants are burned away, but his skin is still intact. What a lucky guy. The name's Orion, bitch! Is that alcohol? Yes, sir, we do suspect heavy alcohol consumption. Mr. Orion, have you been drinking? No. You gotta do it. Sir, liar, liar, pants on fire. I don't think he gets it. The name's Orion, bitch! Ben. What? Did you see Austin? The guy just finished his first ever night shift. He looks super tired. There he is. What's up, Austin? Hey, guys. Hey, Austin, your relief is running a little late. Can you stay for a few more hours? Okay. Wow, he is a broken man. We should totally mess with him. Rich, we are professional nurses. We do not play around. What'd you have in mind? We put apple juice in a urinal, drink it, pretending that it's pee. Classic. Here he is, here he is. Hey, Austin. Guys, I need to speak to you. 1 second. I just need a quick sip of something. What are you doing? Oh, what? I was gonna tell you, I got my patient's urinals mixed up with yours. I'm so sorry, I'm really tired. Hi, ma'am, my name is Ben. What brought you into the ER today? I'm having a really bad stomach ache. I'm so sorry to hear that. We will need a urine sample from you to rule out a UTI, okay? Oh, but I'm on my period. Oh, that's okay. There's some wipes in the bathroom. Make sure to really clean your area. Wipe away as much of the dry blood as possible, and always wipe from front to back. When you start peeing, catch the urine midstream. You don't want any from the beginning, okay? Oh, okay. Thanks. I didn't know that. No problem. Oh, and don't fill the cup all the way to the top. Half cup is more than enough. Okay. I'm all done. Here you go. Great. Oh, it's full. I know, I panicked. I'm so sorry. No, that's okay. My aim isn't very good either. I'm gonna get a towel. I'm so sorry. Trust me, girl. You're not the first person, okay? I'll be right back. Thanks, Ben. Okay, sir, so it looks like that pain you're feeling is an STD. That's impossible. Why is it impossible? Because the last time I did it, we were in a hot tub. So? You can't get an STD in a hot tub. Why not? Duh, because the heat kills the bacteria. Right? No. Okay, kind of a chaotic night so far. Looks like I'm gonna start drinking immediately after making dinner and walking my dog. Why is this old lady yelling at me? I also don't want to be wiping her ass. Oh, she just called me by her husband's name. Do I correct her or do I roll with it? I should be making tips right now. Waiters don't have to put up with this shit. How the fuck are we out of band-aids? Whoa, that psych patient's kinda hot. I wonder if she's single. Holy shit, I need more coffee. Holy shit, I need a smoke. Holy shit, I need a drink. How is there still 4 hours left in my shift? I've been here for days! Maybe nobody will need anything right now and I'll get a second to breathe. Of course not, that never happens. Okay, I've decided I'm going to drink at dinner. I'll make a nice dinner with some wine and I will walk the dog after. Where the fuck are all the other nurses? I know there's other nurses here besides me. There's another hot psych patient. Why are there so many hot psych patients? Is it wrong to sleep with a patient? I mean, the old lady who thought I was her husband wasn't hideous. Man, I need to get laid. Really, where the fuck are all the band-aids? Ugh, this coffee is not working. Okay, I've decided to start drinking right when I get home. I'll finish my shift, and then I'll reward myself with a drink. The dog and dinner can wait. Fuck, I don't think I have any clean scrubs at home. Guess I'll rock these again tomorrow. There's still 4 hours left in my shift? How is that even possible? That's okay. I'm strong. I can make it. Oh, no. Whoa. What? Where am I?
Oh, fuck, that wasn't good. I gotta do something. Can you put coffee in an IV? No, that'd be unprofessional. I should just steal some Adderall. Holy shit! How do we still not have any Band-Aids? I just realized I haven't eaten or gone to the bathroom the entire time I've been here. Okay, I'm drinking as soon as I'm off this shift. I'm going straight to the bar. How are there still 4 hours left on my shift? Fuck it, I'm drinking now.
Patient states she is hungry. Patient provided turkey sandwich. Patient proceeds to use turkey as wet wipe in vaginal area. Sandwich removed from room. Patient provided wet wipes for hygiene. Patient claiming there is a possum in his pants. Assured patient no rodents have been present on his person. Proceeded to escort possum from patient's room. Patient now resting quietly. Care continues. Patient able to demonstrate excellent use of call light functionality. Patient states, quote, "Just give me some water and I'll lick your asshole," end quote. RN declines. Education provided. No further issues at this time. Entered patient's room to find patient standing on bed, naked, swinging his call light above his head like a helicopter and urinating onto the floor. Patient was asked to come down from the bed, to which he replied, quote, "George Washington is in the shitter." Medications requested. Security notified. Patient refused height measurement and states he is 7 foot 11 inches. Patient does not appear to be 7 foot 11 inches. Will measure again when patient is more agreeable. Patient told this RN to, quote, "suck my dick." Patient refuses to see Dr. McMillan because he shares the same first name as their cheating ex-husband. Informed patient that there is no other doctor available. Patient has decided to leave against medical advice. MD aware. Patient arrived by ambulance and verbalized, quote, "Fuck you, motherfuckers. I'm gonna kill you, fucking assholes." End quote. Patient seemed to be agitated upon assessment. Patient given crackers and has since calmed down. MD notified. Will continue to monitor. Hi, sir. My name is Ben. What brought you into the ER today? I need you to test my urine for meth. Did you accidentally take some meth? No. Do you think someone drugged you? No. Then why do you want to be tested for meth? 'Cause I'm worried about my meth dealer. I think they're cheating me. What? Well, some of my friends are testing negative for meth, even though they're buying meth from this one dealer. You want us to run a urine drug screen to test the level of meth in your body? To see if your drug dealer is cheating you? Yes. Sir, we don't do that in the ER. Why not? Because this place is for emergencies. Well then, I also have a really bad stomach ache. How bad is the pain? 10 out of 10. Fine. Okay, sir, your test results are back, are positive for meth. Really? You're also positive for cocaine, marijuana, hydrocodone, benzo, morphine, and methadone. Whoa, hey, I don't know how those got there. Really? Hey, while I'm here, can I get a prescription for Xanax? Are you still having a stomach ache? Stomach ache? What stomach ache? Sir, the doctor is done evaluating you. There's nothing more we can do. I'm not ready to go yet. He didn't even do anything. We've ruled out anything emergent. You're gonna have to follow up with your primary care doctor. I'm sorry. Here are your discharge papers. Man, shut up, you stupid chink. Fuck these papers. Get me some medicine. Sir, are you gonna leave or am I gonna have to call security? Ugh. Hey, have you seen security? No, what's up? This guy in room 2 refuses to leave, and he just called me a chink. Whoa, not cool. Okay, stand by. I'll find security. Cool, thanks. Okay, sir, security is on their way. Oh, look who's back from China like COVID. Seriously? Sir, that is enough. It is time for you to go. Psh. You will not speak to anybody at this hospital like that. Do you understand me? Now kindly pick up your stuff and leave. Thanks, Austin. Sorry I couldn't find security. I don't think we needed them. I got your back, Ben. Ha! You serious? No. Welcome to the ER. How can I help you? I burned my hand. What is on your hand?
Mayonnaise and mustard.
Why is there mayonnaise and mustard on your burned hand?
I don't know. I heard it's supposed to help.
How? You're not making a sandwich.
I was actually making eggs when it happened.
The only thing you need to do with a burn like this is run it under cool water.
How was I supposed to know that?
Here, take these. They'll remind you.
Run under cool water. Are these hospital socks with grips on them? That's so cool!
Yep, and you can find more styles at drsocko.com. Now, come on. Let's wash that sauce off you.
Do you have a container? I want to save some of it for later.
No!
Okay. I love the socks.
Burns! Run it under cool water. Sir, please, just try to relax. Your leg is bleeding.
I gotta go, man. I gotta go meet the wizard.
Just let us fix up your leg, get you some fluids, and we'll let you go.
Let me out, man. The wizard's waiting for me. I gotta go.
Austin, you have the restraints?
Got him. We're ready.
Yeah! Now! Watch out, he's gonna bite you!
Ben, help!
9 hours later.
Hey, guys. Just really wanted to thank you guys for helping me today, you know? Really appreciate it. You guys are awesome. You're welcome, Steve.
Tips from the ER Birthday Podcast. It's my birthday and I'm releasing a podcast. What do you think it's about? Is it why are medical terms so complicated and which motherfucker do we have to blame? Or deathbed confessions, motherfucker's last words. Is it about celebrating badass motherfucking healthcare workers from around the world? Or hospital gown logic? Why is my booty out, motherfucker? Best guess will get a hand-delivered kiss from me, good for anywhere on your birthday. Podcast launching October 11th. Stay tuned, motherfuckers. Okay, Mr. Johnson, I got you some ice chips. I don't want ice chips. I want water. I told you you can't have any water right now. You might go to surgery. I have been here for 6 hours and I am literally dying of thirst. Dying of thirst. You can't be dying of thirst. We've been giving you IV fluids since you got here. My mouth is completely dry. Do you have any idea what that means? It means you're not dying anytime soon, so you're not getting any water. I need water! Ugh. What a day.
Excuse me.
Yes, how can I help you?
I'm looking for Thomas Johnson. Do you know what room he's in?
I do. He's my patient. How are you related?
I'm his girlfriend.
Got it. He's in that room right there. Do not give him any water. Oh.
Excuse me.
Yes, how can I help you?
Do you know where I could find Thomas Johnson?
Yeah? How are you related to the patient?
Oh, I'm his fiancé.
I'm sorry, you said you're his fiancé?
Yes, do you know where he is?
You know, I think he's an X-ray. Why don't you wait over there and I'll check if he's back.
Oh, okay. I'm just gonna run to the bathroom then.
Perfect.
What the f- Excuse me.
Yes, how can I help you?
I'm looking for my boyfriend, Thomas Johnson. Do you know where he is? Auntie, what are you doing here? Amy, what are you doing here? Sarah? Jennifer? Mom? Amy? What are you two doing here?
I should have given him one last sip of water.
Folks, gather around. We here in the ER want to recognize employees who go the extra mile for us, which is why we are introducing the Employee of the Month Award. Ooh, cool. You've definitely got this, Ben. You're the best nurse we got. Oh, thanks, Rich. Hello? I mean, you're the best nurse too. I'm sure one of us will win it. And the Employee of the Month Award goes to... Austin! What? What? Austin has been such a good employee since he came here. Really, a shining light in this ER. Congratulations, Austin. What are we gonna do now? What do you mean? We can't rip on Austin anymore. He's Employee of the Month. The boss loves him. You could snitch on us. Oh no! Hey guys, look what I got! Well done, Austin. Yeah, nice job. Now that I'm employee of the month, things are gonna change around here. No more pranks, no more funny business. Rich, get me a double tall latte. Ben, massage my ingrown toenail. No! Wow. What a nightmare. Hi, Ben. Ah!
Is that food?
Yeah, I got it. What the? Oh, crap. What? My ex is here. It's Stacy. Which Stacy? Crazy Stacy or boring Stacy? Crazy Stacy. Ooh, crazy Stacy. You really need to stop dating girls named Stacy. She's checking in. Don't look. Whoa, 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 that's crazy Stacy? She's actually hot. Why are you surprised that she's actually hot? I think I would put up with crazy Stacy. How crazy was crazy Stacy? Stop saying crazy Stacy. She'll hear us. I can't treat her. I haven't seen her since I dumped her. You dumped her? Yes? Deal with her. I'll get you a beer. Alright. Wait. What? Let me know if there's anything I should be worried about. You know, pregnancies, STDs, that sort of thing. Sure thing. Hi, ma'am. My name is Rich. Before we get started, can I ask you a question? Sure. What's the name of those sea creatures with really big claws? Crabs? I'm sorry, can you say that a bit louder? Crabs! Perfect.
Psych consults here. Must be for me.
Hey, look, scalpel.
Today is the day, baby. Today is the day. I thought about crashing my car on my drive to work today. Who wants to join me on the 6th floor for a swan dive?
If I get one more email about a whiteboard this week, you're gonna have to put me on a hold.
We got a screamer coming into room 5.
Hey, this woman was screaming for Benadryl. I gave her Valium instead. Ativan is a wonderful thing. Why are you crying? It's not even stage 4. If you find me dead here, make sure to transfer me to another ER. Can't be having my coworkers see me naked. I haven't shaved my pubes in years. Good thing is, if you go down on me, it's just like flossing. I am dentist recommended, baby! You want me to go talk to HR? Again? How was my shift? Nobody died?
Hey, what are you guys doing? Looking up how much money everyone makes. You could do that? Yeah, we just found out. What are you doing with your $50 an hour salary, Nurse Austin? Hey, that should be private. What a peasant. How much do you guys make? 60-ish. 60-ish. It's not that much more. What about Tracy? She's been a nurse here forever. About $70 an hour. Whoa. What? She's freaking useless. I know. How much do the ER techs make? $23 an hour. Oh, yikes. You can't even afford rent in California with that. Ooh, what about Dr. Machi? ER physician? $400,000 a year. That's a lot of money. What about that cute nurse, Amy? She's not a nurse. She's a resident. Really? Yes. Not all female scrubs are nurses, Rich. Resident doctor, $60,000 a year. Nothing. But she's married to an orthopedic surgeon. She's not single? Dude, even if she was single, you had no chance. I have a chance. How much does her husband make? About $500,000 a year. Yeah, okay, I have no chance. Hi, ma'am, my name is Ben. What brought you into the ER today? I need to check if I have an STD. Okay, can you tell me a little bit more about what happened? I've been seeing this guy for a couple months and I'm pretty sure he gave it to me. Okay, we'll definitely check you out. I mean, we're not even really together. We're seeing each other, but we're not exclusive, so I know he's sleeping with other people. Do you have multiple partners as well? No, just him. It could be dangerous for you if the person you're sleeping with has multiple partners. Were you using protection at least? Yes, and that's the thing. Even if he was sleeping with other people, it shouldn't matter. Well, because he uses a condom every time and he makes sure to wash it thoroughly after every use. What do you mean he washes it after every use? He washes the condom with hot water and soap before he uses it again.
The same condom?
Yes, the same condom. Why would he wash a new condom?
Hey, Rich, do we have any more of those sex education pamphlets?
No, I just gave the last one away.
I got a girl out here that could really use one.
The girl I gave the last one to thought oral sex was gonna get her pregnant.
Wow, we really need to make more pamphlets.
Yeah.
Hi, ma'am. So we will need a urine sample from your 6-year-old son, okay?
He hasn't been able to pee all morning.
Well, we could try taking him to the bathroom one more time. If that doesn't work, we will have to put a catheter in him.
Put a catheter in him? Would that break his hymen? Would he still be a virgin?
No. And yes, he should still be a virgin. All good questions.
Hi, Mr. Rickett. Were you able to give us that urine sample?
Yes, here it is.
Perfect, thank you.
What is it?
This is your urine sample?
Yes?
You peed in here just now.
Yes.
Okay, we'll run some tests. I'll be back. Mr. Rickett, we have to go!
What? Why?
Your urine test came back and your sugar levels are through the roof!
What?
It's a very serious medical condition. Your body could shut down any minute. We have to go!
No, it was apple juice. I put apple juice in the cup.
Mr. Rickett, you know better than to do that.
I'm sorry. Please, just give me another cup. I'll do it right this time.
Okay, but we need a real urine sample from you this time. No funny business.
Yes, I promise.
Want some?
How did you know it was apple juice?
The cup was ice cold when he handed it to me. Urine comes out warm.
Good catch.
You sure you don't want some? It's really tasty.
I'm okay.
All right.
Okay, ma'am, your dad is all checked in. Go ahead and have a seat out in the waiting room. We will call you in as soon as we have a bed. Do you know how long the wait will be? I can't say for certain, but I can tell you the person who's been waiting here the longest has been here for about 2.5 hours. 2.5 hours? That's ridiculous! My father needs help!
Rachel! Come rub my bunion!
He looks alright. Well, will he at least be in a private room? Well, if one opens up when it's his turn, then yes, absolutely. But I can't guarantee it. We will pay extra for a private room. Yeah, we can't do that. You can wait for a private room if you'd like, but you'd be here longer. Well, what would you do if the president walked in? Surely he would get a private room right away. That is a fantastic point. But there's still nothing I can do for you. Sorry. Ugh. Hey, Rich. Ben, what are you doing here? I thought this was your day off.
It is. I cut my stupid finger making avocado toast. Need stitches.
Nice. Alright, hold on. I'll put you in bed 12 right now. Give you some privacy.
Thanks, man. Who's on today?
Dr. Riesling. You came on a good day.
Awesome.
Alright, follow me. Excuse me, did you let someone go in front of us? Well, he's, What?
Hi, sir. My name is Austin. What brought you into the ER today?
I got this cut on my leg. It's not getting any better.
Can you pull your pants up so I can see it?
Yeah.
Oh, wow. It's really infected. How long has it been like this?
Like 4 or 5 days now.
You're gonna need to change into a hospital gown. I'll help you take your shoes off.
No!
Sir, is everything okay?
I'm not taking my shoes off.
But we have to take your shoes off. And your socks. And your pants.
I'm not taking my fucking shoes off.
Sir, we ask everyone to take their clothes off and change into a gown. It's much easier for us to—
I said I'm not taking my fucking shoes off! Yo, Austin, is everything okay in here? Ooh, wow, that leg is infected.
He won't let me take his shoes off.
Sir, that cut is way too close to your foot. You absolutely need to take your shoes off. I'm leaving.
No, sir, please, you can't leave. This is dangerous. You might need surgery.
Dude, what is the big deal? Just take your shoes off. Whatever it is, I promise we've seen it all. Fine, take the shoes off.
Oh.
I don't want to talk about it.
Did someone paint your toenails red?
I said I don't want to talk about it.
They're really pretty.
Thank you. Okay, I lied. I had never seen anything like this.
Good day.
Nurse, help me to the bathroom. I need to poop.
Mr. Johnson, you're too unstable to walk to the bathroom. I brought you a commode. You could poop here.
Fine, help me to it. Nurse, I'm done pooping. Help me back to bed.
Okay, here we go. Up. Mr. Johnson, are you sure you pooped? Because there's nothing in there.
You think I don't know when I shit or not?
Oh, sir, the poop is still stuck to you.
What? Help me back to bed.
The poop is still stuck to you. Wait.
What the hell are you talking about?
Just hold for a second while I pull it out.
Pull what? Oh!
Oh my god, that's not poop.
What are you pulling that for?
I thought it was poop.
You pulled my balls.
I'm sorry.
Okay, who's ready to have a baby?
That would be me. Please, get this thing out of me.
We actually have a new system that will relieve your pain while in labor by transferring some of the pain to the father, if you're up for it.
Oh.
Yeah, okay, fine, just get it over with. Okay, we'll start with 20% going to the father.
Oh, that's a little better. Whew.
Wow, I'm not feeling anything. Turn it up to 40, Doc. Okay, going to 40. Wow, I like this system. I don't feel anything. Oh, excuse me. Hey, what's up, man?
Dude, I feel like I'm passing a kidney stone the size of a watermelon right now.
Dude, you need to get that checked out. Turn it to 60, Doc.
It's getting worse.
Oh, dude, it's getting worse. Turn it to 100, Doc.
Hi, Mr. Bullet. My name's Austin. I'll be taking care of you today. Do you think you could give us a urine sample right now?
You the doctor?
No, sir. I'm the nurse.
Where's the doctor?
The doctor will be in shortly. But do you think you could give us a urine sample first?
A urine sample? For my back pain? Fuck out of here, man.
It's pretty standard, sir. It helps us...
I ain't doing nothing until I speak to a doctor, man.
Sir, the doctor's gonna ask you the same thing. I promise you, we need a urine sample.
Well, then tell him to come here and tell me himself.
Okay, I'll go find him. Hey, Rich, Mr. Bullet in room 2 is giving me a little trouble. Can you keep an eye on him while I find the doctor?
Sure. Hi, Mr. Bullet. My name's Rich. Doctor, man, finally. Yo, my back is killing me. I need help.
Right. We need a urine sample from you first. Is that okay?
Whatever you say, Doc.
Great. Okay, Mr. Bullet, I just talked to the doctor. He'll be in soon. Thanks, Rich.
Are you the doctor? Oh, would you look at that? I got the wrong room. Bye-bye. Okay, sir, just a few more questions here. Are you sure you don't have high blood pressure?
No.
Because your chart here says you're taking Norvasc and Cozar.
That's right.
What are you taking those medications for?
Those are my blood pressure pills.
So you do have high blood pressure?
No, my blood pressure used to be high, but not anymore.
Because you're taking the blood pressure pills?
Exactly.
Hi, ma'am. We just finished cleaning out your father's wound.
Thank you, Ben.
He has a pretty infected leg ulcer. You didn't happen to put anything in there, did you?
Why do you ask?
Because we found a raw chickpea in his leg.
Oh, yes. I was told that would help him heal.
From who?
It's holistic medicine. Isn't it?
No more raw chickpeas in the ulcer.
What about a cooked chickpea? Hello, ma'am. My name is Rich. What brought you into the ER today? I am having major chest pains. I'm so sorry to hear that. We're gonna get you an EKG and bring you back right now. A spot just opened up. Oh, thank goodness. I thought I was gonna have to wait. Nope, right this way. Okay, have a seat right here. The doctor will see you shortly. Oh my god, is that a homeless person? Yeah. You're not gonna make me sit here, are you? Isn't there another place I could be? Well, this is the only spot open right now, but you're more than welcome to wait in the lobby for a different spot. Okay, yeah, I'll do that. Are there a lot of homeless people here? In the emergency room? Yeah. Ugh, no, I'll wait. Okay. Excuse me, I've been waiting out here for over an hour. Ma'am, the only bed we had, you didn't want, and a couple trauma patients came in via ambulance, so it might be a bit longer. There is another ER literally a mile from here. I'm leaving. Okay, good luck. Hey Rich, where's that lady with chest pains? She just left, but a spot just opened up. Why was she out here for so long? She didn't want to sit next to a homeless person. Really? What a silly reason to delay care. I know! Yeah, oh my god, she did! Oh, she did. No, she did.
Hi, ma'am. My name is Ben. I'm gonna be the nurse taking over for you.
Oh, my stomach. Oh, it hurts.
What's hurting you?
My stomach. Oh my god, it hurts.
They just got you some pain meds. Did it not work?
No, I told them I need stronger pain medication. It hurts really bad.
You know, before I walked in, I was watching you talk on the phone. You didn't seem like you were in that much pain.
It just came on. Please, it hurts.
How bad is your stomach pain right now?
17 out of 10. Please get me something.
Okay, well, if it's that bad, we recommend you don't eat or drink anything to give your stomach a rest. I'll put you on an NPO diet.
Wait, but I have dinner coming.
Oh, don't worry, I'll cancel it.
But I'm feeling better.
Really?
Yeah.
Is your pain still 17 out of 10?
No, it's more like, 10... 2 out of 10.
Perfect. I'll let the doctor know. Hello, my name is Ben. What brought you into the ER today?
I have a surgery tomorrow for the fireballs in my uterus.
Why don't we just start with your name?
Cynthia Oregano?
And you said you're here for...
The fireballs in my uterus.
It says fibroids in the uterus on your chart.
That's right.
Okay. We just need you to change into our hospital gown and socks.
Oh, no need. I brought my own socks. See? It says hella brave, so I'm ready for surgery.
That's cute, but the socks need to have grips on them so you don't slip on the hospital floors.
But they do have grips. See? Swords and shields, because I'm a warrior.
Huh.
I even have a pair for after surgery, where I'll be super relaxed while I recover.
Where did you get those sunglasses?
They're on the bottom of these grips.
What the?
And these are for you for being a fucking fabulous nurse.
Oh. Thanks.
If you look good, you feel good. The comfiest grip socks ever, now available at drsocko.com. Tips from the ER. Measles outbreak. Thanks to a mix of COVID-era confusion and vaccine misinformation, some of you are now deciding you also don't need the measles vaccine, leading to a teeny tiny but real measles outbreak. That's right, measles! Pack your bags. You're about to take a first-class international infectious flight around the world. Around the world! Measles is highly contagious and affects both children and adults. It starts with a fever, cough, runny nose, and then comes a notorious red rash that covers your whole body. Why would you want this? If you need something to wrap around your lonely body for Valentine's Day that badly, get a weighted blanket! Or you're gonna go from 0 to 1 polka-dotted patient in a matter of days. What's the cure? There is none. We just gotta make sure you don't die or infect everyone around you while the virus runs its course. What could you have done? Get vaccinated. It's not too late, motherfuckers. Around the world.
Okay, ma'am, and what medications are you taking?
I take 1 milligram of clonazepam a day.
And that's for...
Keeping me calm.
You have anxiety.
Panic disorder.
Clonazepam. Great. What else?
I bought some over-the-counter dead rocks yesterday.
And what do you use dead rocks for?
To flush out my earwax. It builds up.
Debrox. Okay. Is that all?
Oh, I need a refill on this pussy medication.
Oh, man, we don't deal with animals. You're gonna have to see your vet for your cat's medication.
I don't have a cat. It's for me. It starts with an F.
Your pussy medication?
For my yeast infection.
Fluconazole! For your yeast infection.
Pussy medication.
Please stop saying that. Showtime, motherfucker! Okay, sir, and are you on any medications? I'm taking the Candy Satan for my high blood pressure. Do you mean Candesartan? For my high blood pressure, yes. Okay, anything else? My doctor prescribed me hydrocorn dogs in case I need it. Hydrocorn dogs? In case you need it for what? Pain? I think you mean hydrocodone. Oh yeah, that is how you say it. Is that a medication list? You could just hand me that. There's one I forgot to put on there. Tamsulosin. Tamsulosin? It's for the thing that's growing inside my butt. Excuse me? My doctor stuck his fingers in there and checked it a few weeks ago. Your prostate? Yeah! Oh, tamsulosin for an enlarged prostate. The thing that's growing inside my butt. Hey Austin, you going out for a smoke? A smoke? We're not supposed to smoke. Why not? We're supposed to set a good example for our patients. We can't really advise people on their health if we don't look after ourselves. Whatever, dude. Ben, coming out for a smoke? Yep. Ben, you smoke too? Don't be such a baby, Austin. Besides, all the nurses here smoke. You're really not going to fit in unless you smoke. Are you guys not worried about the health risks? Oh, come on, Austin. Just one smoke. What's the big deal? I mean, okay. Maybe one. Yeah, just one cigar. Cigars? They're even worse! No, they're way cooler. All the best rappers smoke cigars. Relax, dude. Just one cigar. I guess. Here, take my cigar, give it a go, and we'll meet you outside in 5. Okay. I'll see you guys out there. So, will I tell the boss or you? Yeah, go for it. Elizabeth! Yes, boys? Austin, the new nurse, is outside smoking cigars. Thinks he's Jay-Z or something. Are you kidding me? We're supposed to set a good example for our patients. We can't really advise people on their health if we don't look after ourselves. We know. I'll have a word with him. Austin, take that cigar out of your mouth this instant! Ah! Sorry! I don't know why you all complain so much. I think giving birth would be pretty easy. I'm kidding. The process of being pregnant and giving birth is not something I could possibly imagine relating to. But, like any good partner, I can only hope to support without getting yelled at. It's time to do something special for the pregnant moms in your lives, casually trying to repopulate this world. Introducing Dr. Socko's new Pregnant Mom Grip Socks! Fuck, I'm pregnant! Boy mom! And girl mom! With grips for maximum safety in the labor and delivery room. Because when it comes time to deliver, the floors will be covered in your poop, piss, blood, sweat, amniotic fluid, and all kinds of other fun, slippery things that comes out of that wonderful hole we call the vagina, including a baby. You can argue there's nothing more powerful in this world than a vagina. Which makes me question, why do people always say grow a pair of balls? Balls are weak and sensitive. They should say grow a vagina. Those things could take a pounding. Tips from the ER. Sundowning. It's a thing that happens in people with dementia. When the clock strikes 5 p.m. and that sun sets, our geriatric population will transform before our very eyes. Kinda like a werewolf under a full moon, but with less fur and more dentures. 1 minute dear old Granny Smith will be knitting booties for her great-grandbabies. The next, she's convinced she's running away from Russian spies. You ever try to stop a crusty old grandma running away from imaginary Russian spies? It's not easy, but someone's gotta do it. Here in the ER, we will take it on the chin. We will try to remember that it's not really them, but the confusing whirl of their troubled old demented minds. And by tomorrow, they won't remember trying to punch you in the face, or the many creative names they so lovingly christened you with. They'll go back to telling you sweet knock-knock jokes as if you didn't just go 12 rounds with them in the ring at 2 in the morning. And that's okay. It's all part of the job, motherfuckers. Bless their little hearts. Grandma, no, stay in bed. You're gonna fall. Grandma! I'll be right back. Grandma!